All right, well, welcome everyone to Dr. Gabone's fourth COVID-19 response. And today we're going to deal with crisis intervention. And before we begin, we usually do a quick roll call of the members and board directors that we have present. So I will just spotlight those members, and if you can, just wave or say hello. All right. First, we have Kisa Mwakalinga.
She's not here yet.
Okay. Annie Schneider.
Hey, Miss Annie.
Let me spotlight her. Yes, this is so that if you see some of the board members or co-hosts, such as Annie, participating in the actual conference, they're just doing fulfilling their responsibilities and just trying to facilitate. We also have George Gabone.
Hi.
George, where are you at again? I know I asked you last time.
Yeah, I am in Ohio, Cincinnati, Ohio.
Okay, welcome.
Thank you.
We also have Irene Gabone, who is an advisor to QHSC.
Hi, everybody.
Hi.
Hi.
And we have Viola, who I just saw. I'll spotlight you, Viola. Where are you at, Viola?
I'm in Texas.
Viola Mbise from Texas. We have a lot of people from Texas here.
I know. Thank you for coming, guys. I know it's too early, but thank you. We appreciate your time.
And the good thing about this organization is that I'm actually learning another language. So we also have with us Miss Keisha Gabone Muta Biilwa.
Yay.
Wow, congratulations for saying that last name. Hi, everybody. I'm Keisha from New York.
Hi, Miss Keisha.
Hi.
And for some reason, I got to get back to the screen is locked here. We also have with us Nancy Littner. Let's see if I can find her. Oh yes, we saw her earlier. Good morning, Nancy. How are you?
Very well, thank you.
Okay. Also, Catherine Dudek. For some reason, I'm locked. Let me go exit full. I got to exit full screen. Sorry about that. Nancy.
Good morning, everyone.
Good morning, Miss Nancy. Oh, Catherine, sorry, on the background there. There she is.
Good morning.
And let's see here. We also have, I don't know if, was Zainab able to, Zainab, are you there? Were you able to log in?
No, that's a different Zainab.
Okay, and then we also have, let me find Tamasha as well. But we can't, there's no video on Tamasha. So we also have Tamasha Ngalombo from Tanzania. And then finally, we have our president and founder for Quality Healthcare Solutions and Consulting, Dr. Gabone Mwalupindi, and she will kick off this fourth conference on crisis intervention.
Thank you, Mr. Frank. Good morning, everyone. Good afternoon in Tanzania and good evening in Australia, which Ms. Bupe is going to join us in a few minutes. So as Mr. Frank said, this is the fourth COVID-19 conference. We are trying to include healthcare workers from here and everywhere else in the world and try to learn from each other from best practice. So if there's something that we find is useful from the United States, then from UK or from Australia or from Tanzania, we can all learn and use it in our practice. So we have few things. We have to, let me share my screen here. So QHSC is a quality healthcare solution and consulting in a global nursing practice. And so we invited different panelists to come and share their expertise and experience. And we are trying to empower all the healthcare workers, everywhere they are, and so we can learn new things from there. So remember, all the panelists, when they share their experiences or expertise, it's their own opinion. So they're not representing their own respective areas of work. So this is just a learning session. We try to help each other. Whatever we learn from here, we just use as a guide, not necessarily as like a Bible. So welcome, and thank you everybody for coming. And thank you for all the panelists who agreed to come up here. And sure, I saw Dr. Ali is logged in, so we get to meet her too, because she's the third person. So I'll give you a little background for the organization. At least for this year, we were able to do 2 donations. One of them, during this COVID, we knew that essential workers were missing N95 or all the PPE. So as an organization, we were able to donate the N95 for our nurses in New York. And thank you everybody for there, and thank you our nurses for doing, and doctors and all the healthcare workers. So this is just a combination of people who were there and received those masks. Another donation we did in Tanzania, because we knew the masks were, surgical masks and N95 were desperately needed for healthcare workers. So we were able to only do the cloth mask for children, one of the hospitals in Dar es Salaam. So we donate that part. We raise funds from here, we raise funds from Dar es Salaam. So there were 3 areas that donated. So QHSC and the Youth Magnet Academy and Dr. Beverly Choselem, who is the one in here, if you can see her. And she collected a lot of money from a lot of donors from Tanzania, UK, and US. So we were able to donate up to 2,000 cloth masks for the children at the hospital. So we were trying to do this so we can help protect the healthcare worker who provide care for these children, because we could not access those masks to give it to the healthcare worker, so we're able to do for the children, indirectly protecting our healthcare worker. So thank you for all the donors who are continuing to do that. And just before I forget, you met our newest member, Catherine Dudek, and she's the one also was instrumental to help us raise money for the donation that was given to New York nurses. So thank you, Catherine. So coming back to our conference today, we are seeing this screen from World Health Organization, and it's called Corona Scanner. This is like a real live countdown for how many people we have infected for coronavirus. I was just giving you this screen just to give an idea that if you're interested to learn more about this part, you can just go, and on the left side is a list of countries, and this is just a global amount of patients who are infected, patients who unfortunately have passed on, and patients who are actively sick at the hospitals right now, and patients who have recovered. So you can see it's a big number. And this is, I just accessed this at 7:30 this morning. So it always changes every 30 seconds. So it's unfortunate, but it's something that we can learn from it. So to bring back the point to our conference today is we are focusing on the healthcare workers. And as from those numbers, those are just everybody else. And so we know that healthcare workers are frontliners, and those are the ones who, there is a pandemic, they have to go and attend our patients. So at the end of this conference, we are hoping that the healthcare workers who are going to be attending today, they will be able to gain some effective coping strategies and to be able to manage this pandemic while they're taking care of their patients or taking care of themselves or taking care of their family. And then hopefully they will learn something that they can continue use even in past COVID. And just in case if it's not working, then we have Dr. Masomi, who's going to help us to give us some options and address those issues. And then how can we help also our family members? So to start with, I want to encourage to try and find out to help the panelists. I want to try to do the polling to ask people who are here and find out who is. Can everybody see my screen?
Yes, we can.
Okay, and then so I started the polling. So if people can answer this question, that would be great. Like the first question is asking, are you a healthcare worker? So if you answer yes or no, that will be fine. And then the second one is, as a healthcare worker, have you provided care to a patient with COVID? So you can say yes or no. And then have you or a family member have been affected with COVID? So the answer for this, we are trying to give our panelists when they're discussing their topics or experiences to try and guide us to see what exactly is helping and how many people are here who have been affected with. And I think there's one more question, number 5. Okay. So I will give maybe a few more minutes to, so just maybe another minute to allow people to submit their results. So I see only 3 people right now. So as I said, just the answers, we're gonna use it here. So our panelists, we have an idea like how many people are here. I know it's early on in the meeting, but we just wanna give them an idea that how many people are here. And if you know people who are affected with COVID, then at least we can target those conversation or discussion towards people who have been affected. And we're getting close to hopefully people who are submitting their results. So when you finish answering those questions, just make sure you submit. There's a button towards the end there, just submit your results so we know how many people have completed. So we are more than half. I'll give maybe another 30 seconds. And if you have any questions during the presentation and discussion, if you have any questions, then use the chat on the bottom there, and then type your questions either directly specific for one of the panelists or just write in general, and then we can try and answer them as much as we can. So it looks like everybody has responded. Let's share the results. So at least we have more than, almost 80% of people who are healthcare workers. So that's good for panelists because they're here to explain the effect of COVID in healthcare workers. And then we have about, so close to half of people who have not taken care of the COVID, patient with COVID. And then we have, okay, 100%. So nobody has been affected. So we thank God for that. Just make sure these people are using appropriate PPE and then able to protect themselves. That's the great news. And then do you have any opinion? Yes, we agree that it's challenging. We agree that it's challenging to take care of the patients. So that's why Dr. Samboas and Dr. Maria Musomi and Dr. Ali are going to help us to be prepared and help ourselves and help our families to take care of this. And then the last question, the result was about maybe close to 57. Yes, so some people know the result, how to have these coping skills, but then we're gonna learn and probably get the results from our panelists. Okay, thank you very much. I invite Ms. Annie Schneider to introduce our first speaker. I am gonna play this video. It's only like 2.5 minutes, just to set the stage and put everything in perspective. We're worried about our healthcare workers and their families and everybody else in the community. So to just put everything in perspective before Dr. Samboa speaks, I'm gonna play this video, and I'm sure people have seen this video.
There is a heartbreaking loss in the front lines of this fight, a well-known ER doctor here in New York who battled to save the lives of so many others. Her family now says she has taken her own life after describing the horrors she saw. We get more now from NBC's Stephanie Gosk.
Today, a tragedy of a different magnitude among the ranks of health workers who have treated the sickest of the sick. Dr. Lorna Breen, an emergency room doctor at New York's Presbyterian Hospital, took her own life. In a statement to NBC News, her father said, like the many heroes that are still there, she was in every way in the trenches of this war, fighting the effects of this COVID virus that she contracted herself. Dr. Breen survived the virus, but it was the grueling work, her father says, that took a grave toll. Life and death struggles are part of the job at any hospital. But for many health workers, the coronavirus experience has been more difficult and more emotional.
I wish I had known the type of emotional havoc this would have caused on my life, the lives of my colleagues and my patients.
Dr. Rishi Ratan spoke to NBC News last week from the University of Miami.
It's hard not to take your work home with you. I sit at home reliving each death, each delay in my head.
Nurse Ashley Way struggles with the same thing.
I would say that was probably my toughest day, because I've never had to see anything like that ever. Not having someone at their side while they're sitting there dying.
Some of the healthcare workers worry that what they are seeing now will affect them for life.
The risks for their mental health are exhaustion, isolation, and anxiety. And that mix by itself really heightens the risk of everything else.
Tonight, Dr. Lorna Breen's father tells NBC News she was, in every sense of the word, a hero who gave her life for her friends and city. A casualty, he says, of this virus, just like so many thousands of others. Stephanie Gosk, NBC News, New York.
Our thoughts are with Dr. Breen's family tonight. If you or someone you know is struggling with thoughts of suicide, please call the Suicide Prevention Lifeline at 1-800-273-8255 or visit suicidepreventionlifeline.org.
Right, Ms. Annie Schneider to be able to invite Ms. Dr. Sambo. Go ahead, Annie.
Thank you so much. And video, the message was still really powerful and so pertinent to what we're talking about today. So with that, I'd like to introduce Dr. Sam Bohr. He is a licensed professional counselor supervisor in the state of Texas. He specializes in counseling with couples, families, teenagers, and working in groups. Dr. Bohr holds a PhD in counseling with a specialization in child and adolescent and marriage and family counseling from Texas A&M University, Commerce. Currently, he is a professor of counseling as well as in private practice. So, Dr. Bohr, thank you very much for joining us this morning, and I will hand it over to you.
Well, thank you. Thank you. I appreciate the invitation and the opportunity. Can all of you hear me well?
Yes, we can.
Thank you. These technologies, once in a while, we don't get across. But let me begin by saying thank you and paying a lot of tribute to Dr. Harriet for starting this. As we just heard from the video, I think these are times that we all have to be able to come together and pull together and be able to actually support one another. So very briefly, I think I need to just speak a little bit before we get all the questions and get to know what you guys are doing. But as today's thing that we're looking at is the dilemma that the health workers find themselves in. And while all of us are very encouraged and inspired, and truthfully so, you know, our heroes right now, the health workers, the doctors, the nurses, and everybody who is out there. But while that is true, I think everybody needs to pause and ask the question, what's going on beneath all the heroism that we see from our doctors and our nurses? And I think the truth that we are seeing right now is while all this inspiration is coming through, our health workers are anxious and are in constant fear of what they're seeing daily. People are waking up in the morning, they're leaving their families behind, and they're walking into the unknown in their hospitals. And while crisis intervention has always been the preserve of health workers helping those who are in crisis, while that continues, now they are in crisis themselves. So this, if you may, we're looking now at the wounded healer that we need to reach out and be of help to. And why is that true? Because the health workers are taking care of patients themselves in the front lines. And while they're doing that, they're fearing contracting the same. while they're doing that, their working hours could be so long and they're fatigued. While they're doing that, they're expected to be resilient. And their training has been the training has been such that all of you who are in that field right now were trained to be able to help the patient and be there for them. While we've been seeing the news and the pictures and the videos, it's heart-wrenching to see how nurses and doctors cannot reach their patients. And so there are many fronts at which our workers, health workers, are being affected. And they are not doing their work as they've been trained. And you can imagine how the presence of fear itself is in the hospitals and within. And the question comes then for us as we begin this program: how can we help the health workers? What can be done? That way the crisis amongst them and within them can actually be lessened. And what can the population do? What can health workers do? Well, this is going on. You can imagine the stress levels that our health workers are going through. And the stress levels are typical whenever we have stress going on in our lives. Why is this? Because, as you all know, I don't want to go into details. I'm dealing with health workers, so they know this. But our bodies have been designed to maintain an equilibrium in life. And that equilibrium is maintained when we are functioning well. But in this case, because of the stress levels that we're dealing with, we're running into a lot of disequilibrium. Our stress and our natural reaction system for the body is already on now. We have all the reactions of flight, fighting, and even freezing. But the challenge is we are faced with a virus that we cannot see, and we don't know how long it will go. So the idea that these are timeless for now, as we all try to see what can be done to get a vaccine and all other things coming in, then the challenge becomes we are in a stressful situation that is constant and not ending anytime soon. And needless to say, anxiety is a big deal right now. And this is persistent fear, worry, and apprehension. We worry, we panic. We not only worry and panic, we ruminate through obsessive thoughts that are going through what can happen, what if, was I safe enough? Did I enter that patient's room? Was I all taken care of? Did I come out with something? As I'm going into my car, is my car door handle safe? What about when I'm getting into my house where my children are? What do I need to do? So all these are constant things that are in our mind. The challenge, however, is that as an organism, as a human being, we were built and designed to deal with stress within a very short time, and thereafter allow our bodies to find the same equilibrium that it's used to. However, right now, that seems to be constantly going on. And the biggest danger then becomes the same anxiety and the same heightening and arousal of our panic mode is by extension actually affecting our immunity system, the same thing that we are in need of so much right now. So we are running into a very precarious situation, as it were, in the sense that the thing that we need most, which is our immunity system, is being jeopardized because of the situation we find ourselves in. A lot of health workers and general public, sleeplessness nights, we have muscle tightness that we're dealing with. Beyond that, there is depression as well. Staying so much in this situation of anxiety could lead us or spiral into depression. Not to mention that a number of health workers could have been dealing with already some issues prior to this. And that could actually that could trigger a lot of other situations and take us into a lot of depression. And so depressed moods are common now while we're depending on the health workers. A lot of them are struggling with lack of energy most of the time now. While we're depending on them, a number of them, as we saw on the video, are dealing with a sense of worthlessness and sometimes guilt of not being able to be of help, not being able to be by somebody's bed who may be passing on and just needs a hand to touch and just needs someone's presence. They cannot offer that. And therefore we have a lot of these suicidal thoughts as well that depression can put us into. And of course, down the road, hopefully we can discuss how this going forward could also lead to PTSD, where even right now, we are still seeing some of those, where health workers are experiencing the trauma that they're seeing in hospitals, negative thoughts coming in, and avoidance. This is a very big one, because in PTSD, the tendency is to avoid places and people that remind you or take you back to the trauma itself. Now, the places and the people are the hospitals, where it's your workplace and where you are needed right now the most. And yet, that is where your mind is trying to avoid, and the people you are trying not to be there. So there's a lot of increased arousal in our bodies that we're dealing with right now as we go. And the outcomes of this are huge. You know, we're dealing with compassion fatigue. You know, on those that we are there to help. We're dealing with traumatic grief itself. Grief is a big deal right now. We are overwhelmed, and it's increasing with time. And of course, the bigger one here, we're dealing with burnout. We're burning out even before we've not even seen the light at the end of the tunnel, or even the tunnel itself is not appearing yet. Hopefully it is coming soon. But there's burnout and extensively around ourselves. I wanted to address one thing before I take it back to Dr. Harriet for questions, and then we can move on from here. That even the interventions that we're seeing, among them quarantine, or when we quarantine, it's also another big issue. There comes more stress and anxiety while we're in quarantine. So one of the biggest things that we actually are using right now, or intervention, if you will, is in itself as well a cause of anxiety and stress. And more people are becoming depressed while we put them in quarantine. And lately, we've had a lot of news and reported news that people are dealing now with more alcohol and illicit drugs to contain and manage their stress while in quarantine. So if you will, therefore, we're dealing with all these challenges that are surrounding us right now. It's a different time that we're actually working on, as it were. So as we go down the questions and everything, I'm hoping that we can look at the identification. And maybe I can mention that before I get it back to you, that we'll be able to say, how then do we identify what is going on with us? And once we've identified that, what are the things that we can do? At this point, because everybody with doubt outside of us are dealing with all these challenges and anxiety, our biggest help at this point is to be able to strengthen our inner person, our inner beings, ourselves internally, to see how we can manage this. In the absence of help, that we still need the help, but we'll look at how we can identify and be able to get strategies and coping mechanisms as we go down. Dr. Harriet.
Yeah, thank you very much, Dr. Sambo, and I appreciate the explanation and details how for healthcare workers and how can we identify to get, things that would help us to solve this pandemic. My question to you is like, so as a healthcare worker, having that anxiety because I have to go and take care of these patients, and knowing that I still have to go to work regardless of what the situation is as an essential worker, what are the things that I can do to prepare to go to work?
Okay, thank you. Before you prepare to go to work, that's a good question. That's a very important question for all of us. And let me make a correction on the last name, Boré, not Bo, Boré.
Boré, okay.
Boré, yes.
Thank you.
Number one, we want to be able to identify what we're dealing with. Let me give you all a very quick thing on how to identify this. I call it the ABC model. The ABC model, A stands for the affective or the emotions, and B stands for behaviors. C stands for cognitions or cognitive. And so at the very basic point, I want you to be able to say, are my feelings and emotions different? Are they normal feelings? Am I feeling different? So this way, you're able to identify your state of being, mental health at that point. Number B, are my behaviors my regular behaviors that I usually have, or have they changed over time? And if so, what do I need to do? And number C, rather, cognitive, becomes your thinking patterns or your thoughts. Are my thoughts any different? I need to watch for exaggerated thoughts that can help me be able to catch what's going on in my mind, and watch for spiraling thoughts that could easily spiral downward into anxiety and depression. So back to your question, what do I do when I'm preparing? It's very important for us to have a routine of making sure that I change my mindset from fear to, in this state of fear right now, what is my responsibility? We want to allow our minds to shift from the fear itself to say, this is what we're dealing right now with. I may not control the escalation where it is right now, but as of right now, as I even leave home, how do I need to prepare? What responsibility do I have to make sure that I take care of myself? What we want to note is that whenever we're anxious and afraid, we actually make more mistakes. So we want to stay away from that mode of panic and fear and change the question to, what responsibility do I have in making sure that I stay safe?
Okay, thank you. For any of the co-host questions, before I invite a couple of people to ask those questions, I see that people were raising their hand. Any of the healthcare workers? On the list, I see Dr. Gideon Mlawa. Dr. Gideon Mlawa from UK. Dr. Mlawa, can you unmute yourself? Dr. Mlawa?
He is actually unmuted.
Yeah.
We just can't hear him.
Okay, I will ask another question. Because he's one of the doctors from UK, and he's been working with the patients with COVID, and he had a few questions. I see he's unmuted and the videos. Dr. Mlawa, can you hear me?
Yes, I can hear you.
Oh, thank you. So I was going to give you an opportunity, since you've been working with a lot of patients with COVID and in UK, from what Dr. Sam Boré has been talking about, being a healthcare worker yourself, going to work, and what are the things that you have been working, prepare yourself to go in there, and if you have any question for Dr. Sam Boré.
I think the way, based on what I've been doing in London, I'm based in London. I think when COVID-19 came as a pandemic within UK and the rest of the world, the work organization was restructured. Within the hospital, we have to restructure the hospital. So we are running 2 hospitals at the same time. There's COVID and non-COVID areas of the hospital. And with that, at least you know where you're going to work the next day, if you're going to go in a COVID area or non-COVID area. And as far as I'm concerned as a clinician, what I've been doing before going to work is make sure that when I go to work, I've got the required PPEs, which were provided by my department, and also to look after my team as a whole when we're looking at patients with COVID. So our hospital has been changed into COVID and non-COVID area. So from emergency room, from initial wards, which is assessment areas, then throughout the wards, everything has been changed into COVID and non-COVID area. But also there's been redeployment of healthcare workers. So every healthcare worker has come frontline looking after COVID patients. So it's called COVID hospital or COVID wards, 24 hours, 7 days a week. And I think working together with other colleagues, it gives reassurance that when you go to work, you want to be safe in terms of being looked after yourself, but also looking after patients in terms of preparing ourselves. I know I heard what Dr. said in terms of stress, anxiety, and depression among healthcare workers. But given my experience, what we've done within our hospital is to have the so-called well-being team. So there's a team which has been formed. We know that a lot of healthcare workers will be stressed. And with that, the well-being teams look after them. This includes some healthcare professionals, but also we've got the chaplain service, the imams within the hospital, working with us, trying to support either nurses, healthcare assistant, cleaners who can show signs of being affected, so that they can get help in timely manner. But also, when this pandemic came, the rules, at least for London and outside London, for UK, is that if the patient comes with a positive COVID, the next of kin are not allowed to come and visit. So this caused a lot of stress among patients and next of kin. So what we did as a hospital is to try and facilitate the communication between the patient and next of kin by creating a service called Call Video, whereby we facilitate communication between the patient who is in the hospital and next of kin who want to talk to them if they're able to do so. I've seen patients coming into hospital who are already on depression with suicide, taking overdose. And that was due to the effect of lockdown. We had lockdown within the UK, and I saw this patient last week, and when you ask them, they will say that it's because the lockdown has made them more depressed, and therefore they've taken an overdose. So it's an ongoing process. We know that post-COVID, we have a lot of people with a lot of mental health issues, including the negative stress like suicide or feeling depressed or having more anxiety.
Okay, thank you very much, Dr. Gideon Mlao. So for Dr. Sambore, my question is like, for Dr. Mlawa's hospital, that was great. They have some support and structured environment that can support the healthcare worker. So let's talk about the areas that they don't have that support. The person is an individual, or there is no system to help the healthcare worker to prepare either going home or coming to work or them being sick. So what are the specific things, like just say you take away 2 or 3 things that they can use to help themselves deal with this stress, pandemic, and suicide ideation and all this stuff?
Well, thank you, and thank you to Dr. Mulambe from UK. That was good. I appreciate what they've done in the hospital, and that was one of my points of working in teams. Very quickly, whenever the bigger deal that we're dealing with when we don't have that much support, there are 3 things that happen in our minds that are so huge. We become responsible, we take responsibility, and we think it was my fault, whatever happens. Even if I don't take care of myself going to hospital, we can blame ourselves that it was my fault. And then at some point, power and control become an issue where we say we have no power, I can't control any of this, and we seem to give up. And then we also get to a point of thinking that nobody is safe. So 3 things that we can do very quickly if we are alone. Number 1 is establish a routine as a health worker. This routine allows you to prepare in the morning when you're leaving with all the PPEs that you can manage to get, that you actually that keep you safe. So that is crucial, that to prepare a routine in place that you can follow. It helps your anxiety levels at that point. Let this routine include transition periods. What do I do when I'm transitioning from home to the hospital? And part of this could include your driving as well. While you're going to work or riding, many people are not riding on the train anymore, maybe driving yourself. It's important that our self-talk be actually encouraging in our minds as we go to work. If you are somebody who is given to meditate, and if you can do that as you go to work and prepare your mind to be in a positive side, the much the better for you. And so have a transition plan. Even when you're transitioning at the end of the day, coming back home, have a routine. Do I take 10, 15 minutes to just unwind before I rejoin with the family? It's important that we have that transition in place where we allow ourselves to unwind and go through a routine of maybe disinfecting if we need to. Number 2 is a big part of this should be health workers must take care of their basic needs. Very, very important that our basic needs are taken care of. this would include, and hopefully hospitals can do this, even time in between for refreshment, some breaks for refreshment where you can take time to just unwind a little bit within the day. So that routine needs to be in place. And hopefully some of you are supervisors here, and you can extend that to your workers, your health workers in hospitals, to give them room to be able to have those breaks where they can, go in and have some breathing space, and have some small exercise of the activities they can do, but basic needs have to be taken care of. And then if they are by themselves, and even if they have some help at the hospital, check in with family, check in with friends, check in with co-workers. While we've talked about social distancing, I've from the beginning rephrased that myself to say, let's physically distance, but let's be able to connect socially through the different forums that we have, the videos. Dr. Mlawa talked about allowing the patients to have the video. All these WhatsApp groups, all these any other video forums we can get into. It is crucial that we connect with those we love. It's crucial that we connect with those who are going through the same challenges and get support from them as well.
No, thank you very much, Dr. Sambore. I do agree. You mentioned that the healthcare workers, we went to this field because we want to help somebody else. So caring is an essential part of our work. And so now we always want to care for everybody else. And sometimes we forget ourselves. And then so it is important for us to be able to build our own self concept to say, I need to take care of myself. I need to be well before I can take care of somebody else. And that's when we unfortunately lose our patient, it becomes an issue that we have to be able to deal with that part and then leave that part and go home and continue with our life. So to connect to our next speaker, I am gonna, again, try. Before I invite Annie back to introduce the next speaker, there is this part we're just connecting from Dr. Sambore that nurses have to take care of the patients, and they will exhaust themselves to be able to make sure the patients are okay. As doctors, the same thing. Healthcare workers always devote themselves to be able to make the other person feel well. And then so there is a story this 3 days ago from Florida, here from Florida.
Becoming a nurse was a dream come true for William Coddington.
We were just, best of friends.
His best friend, Robert Marks, says it came naturally to the 32-year-old.
He was just always there for a laugh and support. So the nursing thing was just a natural extension of his personality.
Friends and family say Coddington had battled opioid addiction, but was committed to recovery and relished his job at a West Palm Beach, Florida hospital. But that began to unravel in March as COVID-19 patients showed up in Coddington's intensive care unit. His father, Ronald Coddington, says the ICU was no longer a reaffirming place.
The COVID ward became the war zone. And that changed him. One of the things I can tell William was, in a sense, haunted by was his concern about the death rate. As a nurse wanting to help people, I think they all feel a sense of defeat when someone dies, especially if someone's not ready to die or not terminal.
On April 25th, Coddington was found dead in his car. His family suspects a drug overdose. As COVID-19 patients inundate hospitals across the U.S., healthcare workers are trying to cope with the psychological trauma of treating desperately ill patients. Psychiatrists told Reuters that those with histories of substance abuse may have more difficulty coping with fear and witnessing so much death during the pandemic. In messages with his son the month he passed away, Coddington's father wrote, quote, "You are so needed right now by others. You can be great." The two then exchanged I love yous.
want to invite Ms. Annie Schneider to welcome the next panelist.
Thank you so much. So next we are going to hear from Dr. Maria Mosomi. She is a board-certified family psychiatric mental health nurse practitioner with over 5 years experience treating individuals' mental health and behavioral health issues. She is the founder and CEO of Texas Advanced Behavioral Health and Private Psychiatric Clinic in Arlington, Texas. She loves God and has a passion for healthcare, community empowerment, and leadership. Additional background includes neurotelemetry nursing and psychiatry. She acquired a Bachelor's of Science degree from San Jose State University in 2001, a Master of Nursing from the University of Arlington, Texas in 2012, and a Doctoral of Nursing Practice with a focus in healthcare systems leadership from Chamberlain University in 2019. So I'd like to welcome Dr. Maria, and we look forward to hearing from you.
Thank you. Good morning and good afternoon, everyone. Dr. Harriet, thank you so much for having me on here. I'm going to just speak as a nurse and as a provider, and also as someone who takes care of individuals who have mental health issues. I have, in my family, I have many nurses. My sister is a registered nurse who works in the ICU in New Mexico. I have an aunt who works in the ER in California. My mom is also a nurse. She's an LVN who works at a nursing home, and she's been working there well over 20 years. When COVID-19 hit, it was really rough in our family because, you know, pretty much, and oh, I forgot my father. I apologize. My father is also a nurse. He also works at a nursing home as an LVN. So when COVID-19 hit, it was really hard for us because there was a rush on finding out who has the proper protection. Both of my parents are past the age of 60, and actually my mother has cancer. And so it was quite, there was a lot of anxiety and stress on my end, asking everyone if they're okay, asking my mom to stay home, but she wants to be with her patients and to help out in the at her facility. And my sister has worked with patients who have COVID-19, and actually she had a colleague who contracted the virus and did not survive. My aunt worked in the ER, and it was extremely hard for her as well. She would call me in tears saying that I have to isolate myself even when I go home. You know, I work all day wearing the mask, taking care of patients. I love my patients. I love my job. And I just can't stay home because I have to be there. But as soon as I get in the driveway, park my car, I start questioning, you know, do I have the virus? You know, I go straight to the garage, you know, take my clothes off, put it in the laundry basket. I have a pair of clothes on the other side that I have to put on. Then I'll go straight, take a shower, but still I don't feel comfortable playing with the kids, you know. I don't feel comfortable being too close with them. So I find myself putting distance, even though I want to hug them and tell them I love them, you know. And she still hugs her kids and tells them that she loves them, but there's always these thoughts of, you know, what if, you know, I messed up somewhere and I didn't protect myself, you know, in the ER, or what if I forgot to wash my hands. So there has been quite a lot of anxiety. For my parents, my father still works. My mom is not working, but my father comes home every day from work. And there's just the two of them in California. And so my father also talks about how difficult it is to come home and to know that you have somebody who's immune compromised at home. And my mom had been admitted twice. The first time we actually thought she had COVID-19. And we experienced going, you know, my father had to take her to the emergency room. She was taken and he stayed outside, and, you know, she had all the symptoms. We thank God it was pneumonia, but she had all those symptoms: chest pain, shortness of breath, fever. And we went through the whole talking on the phone, her crying because she's like, you know, everyone is coming in here and she's a nurse. She's like, I have all the symptoms. You know, even the doctors think I have COVID-19. And we waited for about 4 hours to get the results. And the relief that she had when she got those results, it was like she was healed. But in those few hours, we went through agony, you know. Number one, she was by herself, and we come from an African culture. So she couldn't be with anyone. My father could not go in. We were lucky my aunt works in that same hospital, so she was able to see her and wear the appropriate PPEs. But we talked about how she felt during that process, because while she was in that process, there was such extreme anxiety from everyone. The only thing that she could do is talk to us via WhatsApp and be in tears, because she did not know how soon, you know, things will go south. You know, this is the first time she had oxygen on. And it was extremely frightening for her and extremely frightening for us. She talked about how, you know, she had all the thoughts, what would happen to us? What can happen? And finally she said, you know, I sat there and said, this could be it. This could be the last time I saw your father at the door. And this could be the last time I talk to you guys, and I'm going to be here all by myself and not make it. So COVID-19 has really affected a lot of people. And for us as healthcare providers, sometimes it's good to put our titles aside and to have forums like this and be human. You know, just talking about the process of what my mom went, I feel like tears are coming up. But we are conditioned to be the provider always, at home and at work. And sometimes it's extremely hard to just put our hats down and just say, you know what, I am just Maria, and Maria is hurting right now. Or I'm just Maria, and Maria is having an anxiety. You know, you can have anxiety as a healthcare provider. You're not immune to it. Even if you're in mental health, you can have anxiety. And sometimes we get worried because we go through our provider hats and we start thinking like, oh, no. So I have anxiety. Does that mean I have mental health? Does that mean I'm going crazy? I can't sleep at night. Oh my goodness. Okay, so if I can't sleep at night, maybe I should go buy some Benadryl. Okay, maybe the Benadryl will help me. Oh, no. So the Benadryl is not helping. Okay, maybe that's not working. Maybe I can have a glass of wine. Oh, the glass of wine is helping me every night. But now you're going through bottles and bottles and bottles of wine. And so it's so easy to slip from that hero situation. And when you're by yourself, you're just you're just a human being, and you're bombarded with all kinds of thoughts. And being a healthcare provider, we have the hardest time to be a patient, we have such a hardest time to be vulnerable because we are geared to be the superhero. Dr. Bore has already talked a lot about anxiety. And what I do is really kind of work with people when psychologists like Dr. Bore and therapists give coping skills, and those coping skills don't work. Usually they get referred to me for medication management. So I have a quick slideshow here. It's very simple. I'll talk over it. And let me share my screen here. So I already kind of explained my situation with my family and being a nurse and going through this pandemic. And one thing that I would urge all healthcare providers is, like Dr. Bore say, it's okay to be vulnerable and it's okay to be human for once, and to talk about these things and to not self-diagnose or self-treat. Some of the mental health issues or concerns that we are seeing and that we're going to be seeing is in the near future in the populations that we treat, and in, you know, just ourselves. Dr. Bore talked about, you know, anxiety, depression, post-traumatic stress syndrome, substance abuse, and suicide. I love this picture, how it's depicted, showing the tears. You know, it shows someone looking out, crying out for individuals that they care for, but also tears come also from internal. And some of the issues that we go through are internal issues. No one is immune to having an illness. No one is immune from having high blood pressure. No one is immune from having diabetes, and no one is immune from having a mental health issue. And it doesn't mean that you have to be born with it. Some of these situations are acquired, like, for example, going through a pandemic and suffering and seeing such traumatic things, and those things can affect you emotionally and psychologically. I found this wonderful chart on mental health. I love this chart because it kind of helps us as individuals kind of check in on ourselves and see what kind of help we need. As you can see on the green, it talks about mental health as healthy. We talked about having normal moods, calm, having a good attitude, good sleep patterns. But currently, a lot of us have been working overtime and on crisis mode. This screen here kind of represents what we can do when it comes to self-care and social support, like Dr. Bore talked about. But unfortunately, sometimes, depending on where you've come from, depending on what kind of coping mechanism you have, or even family history, you may be prone to developing severe anxiety, depression, or post-traumatic syndrome. And the trigger could just be a pandemic like that we're going through right now, or having a family member or loved one who has passed away, or even being in a situation like abuse and stuff like that, or an accident. So what happens is that we can go from being healthy and having the coping mechanism to injury and illness. And this is when the anxiety does not go away, you know, when you can go days without sleeping, you know, you've tried the Benadryl, you've tried taking time off, but still you're having multiple emotions and feelings about what has happened in your situation, or just depressed about how you feel in the situation that you're going through. typically what I would say to people is, if you get to a point where you are having issues with sleep, having negative thoughts, having depressive symptoms, talk to a professional. Talk to, you can definitely talk to a therapist or a counselor. You can talk to your chaplain, like the other doctors spoke how, the chaplains are there to help you. But if you still feel like those symptoms have not gone away, reach out to a professional and have a conversation and be frank about it. Just be real, just be you, and express your feelings like, hey, this is what I'm going through. I'm hoping it's not, anxiety, or I'm hoping it's not, depression, but this is what I'm feeling. And these are my fears. And have somebody who's a professional walk with you through that path, and so that they can be able to help you. Because as most of us know, providers cannot treat themselves. Like in Swahili, we say, ganga hawezi kujigangua. You can't treat your own self. So allow somebody to be on the other side and have a frank conversation about your feelings. One of the biggest concerns with pandemic, and Dr. Bori touched on this, is the post-traumatic stress syndrome. Most of you probably have heard about it, and some of you have probably experienced it and not known what it is. Some of these symptoms could be missed because we're so busy taking care of other people, but they also can be missed because we're suppressing our emotions and feelings, and we're not true to how we feel. Typically, post-traumatic stress syndrome is a mental health condition that is triggered by a terrifying event that a person has experienced or witnessed. So having to take care of patients or seeing patients who are dying in unimaginable numbers over and over and over again, having to be in a situation that you are dealing with a pandemic that scientists don't know about, how we're going to get the treatment, how we're going to get a vaccine, is a traumatic event. It's truly a traumatic event. Some of the fears that we talked about is just ruminating on, how am I going to take care of myself when I am taking care of others? How am I going to take care of my family? And how am I going to take care of my colleagues? Because there are many nurses out there who have had to be providers for their colleagues while they're in the ICU or diagnosed with COVID-19. So I am taking care of someone who should be taking care of another person. It's just like almost like seeing yourself there. It's the hardest thing that any human being can do. Taking care of somebody who has COVID-19, who was right next to you taking care of patients. Then you start asking yourself, am I next? What if this happens to me? So there's a lot of thoughts that we as nurses and providers go through, and a lot of thoughts that we don't talk about, as just humans, because we're like, I'm embarrassed about talking about it, or fears of being stigmatized as going crazy. Some of the other symptoms of PTSD is flashbacks. A lot of people talk about what's going to happen years from now with our healthcare providers. Some people may develop this post-traumatic symptoms and may have, flashbacks of taking care of patients, flashbacks of not having the proper protective gears. Some people may experience nightmares, recurrent dreams of, the situations that they've been going through. Dr. Bori talked about avoidance. Individuals who have post-traumatic syndrome, they try to avoid places that remind them of those trauma. And unfortunately, as nurses, that is your livelihood and that's your passion. So you have to go to work every single day. So some people have experienced panic attacks. They're driving to the parking lot or walking to their hospitals, and before they get in, they're having extreme anxiety and panic attack because they know they're about to enter a place of, you know, where they don't know if they're going to come back outside of the hospital with COVID-19. Mental health providers survival guide. We talked about self-care. Talking to others about what you're going through is very, very important. Taking time for self-care. That's the hardest thing that we have as healthcare providers, because we are the heroes. We are naturally ready to take care of other people. And sometimes we actually feel guilty when we have to take care of ourselves. But you have to make it a point to take care of yourself, because just like most people who've flown on an airplane, they say if the airplane is going down, you need to put the oxygen mask on yourself first before you can put it on the person next to you or the child next to you. So taking care of yourself is super important, because it allows you to be rejuvenated to take care of other people. Recognizing what is typical and what is not typical about yourself. Going through this pandemic and being a healthcare provider, it's very important that you also do self-check on yourself. Are you sleeping enough? Are you having recurrent thoughts of what's going to happen to you, as far as, you know, am I going to get the, you know, the COVID-19? Did I wash my hands? How many times did I wash my hands? You know, are you having recurrent thoughts of not surviving? You know, are you having recurrent thoughts of, you know, what would happen if you get the COVID-19? You know, are you having abnormal thoughts of, you know, you infecting your families? Recognize some of the typical thought processes that you're having, and also try to also recognize abnormal coping mechanisms, such as substance abuse. It's easy for some people to say, well, I'm just going to drink a glass of wine. You know, this glass of wine helps me go to sleep. You know, eventually, sometimes that glass of wine becomes bottles. It becomes a daily thing. As healthcare providers, you know, it's difficult for us to go and seek professional help. You know, are you noticing that you're taking, you know, sleep aids over the counter? You know, are you noticing that, you know, and I'm going to put it out there, taking medication from the hospital to help you feel better? You know, obviously that is not the right thing to do, but some of us in different areas have, you know, pharmacists who are friends. Are you noticing that you're doing behaviors, coping mechanisms that are not appropriate in order to treat yourself, because you don't want to tell someone that you're going through a depressive episode, or you can't sleep at night? Talk to a professional. Talking to a professional is very, very important. We are also in the same field as you, and we're not immune as well. If you're having insomnia, going days without sleeping, having panic attacks, you know, nightmares, flashbacks, you know, having depression, and even having suicidal thoughts. One of the biggest thing about suicidal thoughts is most people are afraid to talk about it. People have suicidal thoughts. Some situations in life get you to a place where it's unpleasant. Talk to someone. This can save your life, you know. Sometimes the person right next to you is going through the same thing and is probably afraid also of speaking out and expressing what's going on. So talking to someone helps validate what is happening with you, and helps you understand that it's not all in your head, that you're not losing it. It may be something that can be helped with just talking to someone like Dr. Bore and getting coping skills and processing the information and utilizing the information. But sometimes it may mean taking medication. Superheroes need care too. You know, when you are a superhero and you're fighting something like coronavirus, you do get tired and you also need help too. The biggest issue that we have in mental health is the stigma. The stigma prevents us from getting the help that we need. There's fears of what others are going to think about us, what others are going to think about us being quotes unquote crazy. This is not, mental health is not just something that happens to our patients. Mental health is something that can happen to any one of us at any time. And at the time that we're in with COVID-19, many people will experience post-traumatic syndrome from taking care of patients and being in traumatic situations. And some people will be able to cope with coping mechanism, but others may need some medication to help with anxiety so that they can be able to handle being functional day to day. Some people may need something for depression. Some people may need something for sleep. It's okay to talk about it, you know. There's a misconception that, you know, when you see a mental health provider, they're just trying to give you medications. Truly and all, the number one frontline thing that we try to do is try to see what coping mechanism that you can utilize in order to be mentally healthy and stable. But if it gets to a point where you're not functional, you're having severe panic attacks, you can't go to work, you're not eating, you're getting angry, you're not sleeping, you're crying a lot, you're having these nightmares, you're having these flashbacks, and at times even having thoughts of, you know, it's better for me to not exist than to have to be in this, have all these thoughts. It's okay to ask for help, and it's okay to be medicated or take medication for a short time. Some of the other fears that we have as healthcare provider is the diagnosis. The diagnosis, that's a challenging for us because to state that I'm going to see a mental health provider, remember your body as a whole, and it affects you emotionally, mentally, physically, and things on the outside, stressors, situations such as pandemic can affect you, how you feel. You know that your brain is so powerful and it's able to recognize fear and trauma and put it in memory and recall things to protect you. But sometimes we know that our bodies can have misfunctions or can have imbalances. I would say don't worry about the diagnosis. Stay focused on you being healthy so that you can provide care for yourself, for others, and your family. I love being in this forum because this is an opportunity that we can help each other by reaching out to each other and sharing and creating an opportunity so that we can be comfortable enough to seek the help that we need. So Dr. Harriet, back to you, and thank you so much.
Okay, thank you very much, Dr. Maria Musomi. You have mentioned, I mean, a few things but one of them is valid for the healthcare workers to talk to other people so that also they can validate what we feel and feel that is not in our head. I think one of the misconceptions we all have is we are supposed to be strong for our patients. We are supposed to be the healthy one to take care of the sick ones. So when things start happening to ourselves, we start questioning, like, if I say I'm going to look like weak, or maybe I should not be coming to work, and we start hiding it. And of course, that's why Dr. Sambore was saying coping mechanism. We need to learn those things and be open. And you just added to it that we need to be able to verbalize it so we can find resources, and it is okay to be not okay. So I think that is the one biggest thing I think we should get out of this conference, is saying that it is okay to ask for help. And I mean, as I said, unfortunately, the videos were not successful, but both of them were talking about taking care of themselves, and then you give yourself so much in taking care of the patients. And then you see that no matter what you do, the patients are going away or passing away. So that you take it with you, whether you like it or not. And then so when you feel like I did everything I could, I stayed 16 hours, 20 hours, and still I lost my patient. So for healthcare workers, we take it in. And because you count as a failure because I did this, I responded to the code, then what happens? I mean, that patient should have been alive. And there are certain things that we can save and we should be okay if they happen. And I appreciate both of you saying that it is okay to ask for help, even if we are experts in our areas, but still it is okay to ask for help. And I think that's the part which I think as a healthcare worker, we need to take care of ourselves first before we can take care of others. And I know, Ms. Irene, you said there was a couple of questions from the chat. Can you, if you have questions for Dr. Maria Masomi, please. Irene?
Hold on.
Okay.
I had to unmute first.
Okay, go ahead.
I lost it. Oh, this was a concern, was a question Mr. Gilbert asked. He was wondering if, do you think healthcare industry need to prepare for other challenges after the COVID pandemic, such as depression, fatigue, and burnout?
I think part of it, Dr. Sambore, yeah, was answered by Dr. Sambore and Dr. Maria added that part. Unless if there's something else you want to add, Dr. Maria, quickly on that one. I know you mentioned it, but.
I was just going to mention that's a wonderful question. Yes, that is something that we do need to prepare for, particularly because in the psychiatric field or mental health field, we have very few providers out there in this particular field. So we do need to prepare for it and be ready to be there for people and to be able to help them during this transition and provide healing for them.
Okay, thank you very much. And I know healthcare workers, they do have their families too, and community at large. And so when we are talking about them, also we have to include their family in addressing this stress and dealing with the pandemic. And other kids, then they will see their parents leaving home, not sure if they're coming back, or because remember for the mental awareness for the kids, they have no idea what exactly is pandemic. Or everybody is talking about, oh, they're thinking, okay, I have to stay home, but why can't I go and play with my friends? So because they don't see that COVID coming outside, it's like psychological fear, which Dr. Sambua could have, we probably have an opportunity to answer that question. So for the kids, we do have to help understand or empower the healthcare workers to go and take care of their family. So before I can do that, before I invite Dr. Ali.
There's another question.
Oh, we're gonna have more. We're gonna ask the questions as soon as Dr. Ali speaks. Yeah. Okay, so before I invite, there's a story from BBC and they're talking about the children who are admitted and
Way to get it out. Good job. Good.
Mom.
Good job.
I don't feel so good.
I know you don't feel so good.
When the doctor came in and told me that the test was positive, I just started crying. My initial thoughts were, I don't understand. We stayed at home. We pulled him out of activities. That was immediately followed by, oh my gosh, he has coronavirus and he continues to get worse every single hour. Where is this headed and how bad is this going to get?
Yes? Are you still hungry?
What I found most helpful to me in the hospital was just trying to stay present in the moment and not let my mind wander too far down the what if. What if he gets worse? What if he gets intubated? What if he gets sedated? I never let myself go to the what if he doesn't come home. I just wasn't willing to go to that place. And it's really hard to do that as they're turning up the oxygen every hour. but it did really help me.
We want to be able to obviously love her for the rest of her life while she's here, and just lucky that she's here. I just don't know if I'm ready to give up any more time there. I mean, her daddy keeps saying that she's never ever getting to move out, like, ever. That's right, never. Because we're obviously just at a point now where we feel as though we've missed a lot there.
My hope is that I don't become somebody who's so overly cautious that I don't allow them to live their lives. But this just really drove it home that my time with my kids is precious. I don't want any parent to be in a position of, I call it the shoulda, coulda, wouldas. I should have stayed at home. I wish I would have stayed at home, of regretting the choices they made because their child gets sick. It's much easier on a parent to say, I did everything possible and this still happened, than, oh my gosh, we took him to a playground and we didn't take it seriously, and look, my kid is in the hospital on a ventilator.
Which could be one of the healthcare workers. As a parent, what do you need to do to be able to take care of the child who is sick? Oh, and another side, if for parents, you are home, keeping the kids at home, trying to keep them safe, what should we do to be able to prepare for this situation? So hoping to get that answer from Dr. Ali Montalego, and I'm gonna invite Annie to welcome Dr. Ali.
Hello, thank you very much. So Dr. Ali graduated from Royal College of Psychiatry in the UK in 2018 and moved to the super specialized field in pediatric child and adolescent mental health in 2019. She has experience in adult mental health since 2011. She graduated with an MD from KCMC in 2008 and completed an internship in the UK 2009 to 2011 as a healthcare worker. She's come to share your experiences, and so we welcome her to speak.
Dr. Ali.
Hello.
Hi.
Yes, excellent. Hi, everyone. Right, so I'm glad that I've come after Dr. Bore and Dr. Musomi, because they've spoken a lot about mental health already. So my talk will be a lot in Swahili and a few translations here and there in English of words that I couldn't find in Swahili. So bear with me. Right, so Dr. Mwalpinda, do you have my script, or because I'm not very good with sharing the talk? I don't know if you have it at all. So there's that one and the other one.
Let me go find it.
Right, so swali la kwanza kuhusu wazazi wanaowaangalia watoto wao wanaoumwa, natumaini kila mtu anaelewa kwamba unaendelea kama kawaida, kama ugonjwa mwingine wowote ule, kwa sababu mtoto yuko makini sana na hofu ya mzazi. Kwa hiyo mzazi akionyesha kuwa ana mashaka yoyote au anaogopa chochote, mtoto naye atakuwa na mashaka, naye atakuwa anaogopa. Kwa hiyo utakuwa mnaendelea kwenye path mbaya. Kwa hiyo ni vizuri kama mzazi mwenyewe anajituliza moyoni na kuwa na mtoto. Na jana niliangalia video ya mama mmoja alikuwa anaelezea jinsi gani amemtunza mtoto wake akiumwa ugonjwa wa COVID hospitali, na jinsi gani wao wametengwa na hospitali. Kama kawaida ugonjwa unatengwa, lakini kwa watoto, mzazi anawekwa pamoja na mtoto kipindi chote ambacho mtoto anaumwa. Kwa hiyo mzazi anaona jinsi gani mtoto anavyozidi kuumwa. Kama mnavyoelewa, COVID inaanza taratibu, alafu inafikia peak. Unaumwa, unazidi kuumwa kila siku, unaona unazidi kudeteriorate, alafu siku moja una take the turn, alafu unapona au unaugua zaidi, unakufa. Kwa hiyo mtu haelewi jinsi gani ataenda njia gani. Kwa hiyo mzazi kuona hiyo inapoendelea kila siku pale pembeni na mtoto, inakuwa ni hofu kali sana na inamtisha mzazi sana. Lakini ni vizuri kama uko na mtoto wako, una put on a brave face, unakuwa jasiri na unaonyesha furaha usoni, na unamwambia mtoto maneno ambayo yatampa moyo kuendelea kupumua, kuendelea kukohoa, kuendelea unakuwa wewe ndo nesi, ndo muuguzi wake. My talk was more about the community, kwa sababu mimi nafanya kazi kwenye community service, naangalia watoto ambao wako kwenye majumbani kwao. Kwa hiyo most of my contacts are via telephone, na saa ingine naenda hospitali, naona watoto ambao wamezidiwa wanakuja hospitali. Kwa hiyo ni vizuri kama ukiwa group watoto wote kwenye makundi manne tofauti. Kundi la kwanza ni watoto ambao wako kwenye familia nzuri. Nikisema familia nzuri namaanisha stable family, mama, baba, au mama peke yake au baba peke yake, lakini yuko na mtu kwenye familia, wadogo zake, dada zake, kaka zake, familia imekamilika na kielimu wanaendelea vizuri, wako kwenye a good status, a good social status, niseme hivyo. Hiyo ni kundi la kwanza. Kundi la pili ni watoto ambao hapa Uingereza tunasema wanahitaji kuwa shielded, watoto ambao wanaumwa, watoto ambao wana upungufu wa kinga ya mwili for whatever reason, watoto wenye pumu, watoto wenye magonjwa mengine kama kisukari au pressure kupanda au kuumwa moyo. Kwa hiyo watoto wote wanawekwa kwenye hilo kundi la pili. Kwa hiyo hawa watoto kwenye hiki kipindi cha COVID wametengwa kabisa. Kama unavyoweza kuimagine, wametengwa kabisa, hawatakiwi kukutana na watu nje, hawatakiwi hata mtu wa familia hapo ndani kama anatoka nje sana, hatakiwi kukutana na huyu mtoto. Kwa hiyo hilo kundi la pili. Kundi la tatu ni watoto ambao wana social status ambao sio nzuri. Kwa hiyo watoto kwenye familia ambayo kuna umaskini, au kwenye familia ambayo mama au baba wana matatizo wenyewe, labda wao wenyewe wana magonjwa, aidha magonjwa ya physical ya mwili au magonjwa ya akili, au wazazi wanatumia pombe au vilevi vyovyote. Kwa hiyo social status yao ni mbaya au watoto. Kwa hiyo hawa watoto tayari unaona wako vulnerable. Alafu kundi la mwisho ni watoto ambao wana matatizo ya akili of whatever nature, either wanakuwa wana learning disability, au wanakuwa wana matatizo ya msononoko, depression, au wanakuwa wana matatizo ya yale matatizo ambayo sisi tuna group kama developmental disorders, kama ADHD, ambayo mtu anakuwa na attention problems, mtoto hatulii, yuko pupuru papara kila saa, au mtoto anakuwa na autism, mtoto ambaye anakuwa kidogo upungufu wa akili, mental retardation, na anakuwa na vitu kadhaa. Yani, kwa hiyo watoto wanakuwa group kwenye hilo kikundi cha 4 ambacho wanakuwa na matatizo ya akili. Kwa hiyo ukiangalia watoto kwenye haya makundi manne, afu ukawaangalia katika kipindi cha COVID, ndo unazidi kuelewa watoto gani wanahitaji kuangaliwa zaidi au kufuatiliwa zaidi. Lakini mimi nasema watoto wote, kikundi chochote kile ambao watu wanatakiwa kufuatiliwa kwa umakini. sijui Dr. Mwalipinda ulipata my talk.
Which one do you want?
Screen. The first one I sent you. I sent you two. So there should be another one.
Okay. So let me go back.
Just before that, I sent you another one. I didn't think that would open actually, but the first one should.
Do you see that one?
Let me see. Yes, that's the one.
Okay.
Yeah, now if we can just, oh, I can manage it. That's good. Sorry. Samani, maneno yote yamekuwa mistari mekundu kwa chini ni kwa sababu ni ya Kiswahili ndo maana. Right, so I'll just use my own. I apologize. Wengine sijui kama wanaona hayo, but anyway, nitaongea. Kwa hiyo kikundi cha kwanza au watoto wenye wenye tuseme maisha mazuri. Tanzania utasema mtoto ana maisha mazuri. Mabadiliko yaliyoletwa na COVID hayatawasumbua sana. Kutokwenda shule, inawezekana kuwa wana nafasi zaidi nyumbani ya kusoma, wana uwezo wa kupata link au contacts na walimu wao, wana uwezo wa kuendelea na elimu kama kawaida. Chakula nyumbani hawana wasiwasi nacho. Unaelewa, kila kitu kinaendelea vizuri na hawana hofu kama watoto wengine ambao unaweza kuelewa wanayo. Ingawa ndio unaweza kusema wana matatizo yao pia, lakini kiukweli maisha yao ni mazuri. Kikundi cha pili, watoto ambao wanatakiwa kuwa watoto ambao wako hatarini, maana wanapaswa wajitenge kabisa. Hawa wana hatari ya kupata matatizo ya akili. Kwa hawa watoto na wazazi wao kutoka nje ya mlango au kwenda dukani au kukutana na mtu aliyotoka nje, hiyo yote inaonekana ni hatari mno. Kwa hiyo unaweza kuona jinsi gani hata wazazi au watu wa kwenye familia wanaweza kuwa wana hofu kubwa kila mara. Kama Dr. Mosomi alivyoelezea kuhusu mama yake mzazi, inaonyesha jinsi gani mtu kama yuko kwenye familia anahitaji kujikinga, inasumbua na inaenda kwa kila mtu wa familia hiyo. Kikundi cha tatu ambacho ni cha watoto ambao wana social status ambayo sio nzuri sana, watu ambao wako kwenye umasikini au kwenye hali mbaya ya kimaisha. Hawa watoto, kwa hiyo imagine kwamba hawa watoto hawana haja ya kujitenga, lakini wakiwa nyumbani hawaendi tena shule. Kwa hiyo ile structure au ile routine ya asubuhi kwenda shule na jioni kurudi nyumbani, hiyo yote imevunjika. Sasa hivi muda wote wako nyumbani na wazazi wao nao wapo nyumbani. Kwa hiyo muda wote wanawapa kazi za kufanya, au utakuta watoto wanaachiwa tu huru wafanye lolote wanalotaka na wazazi wanaendelea na lolote wanalotaka. Kwa hiyo shule hapo kabisa imestop, na watoto pia wanakuwa at risk ya kupata matatizo mengine, kuumizwa kwa njia tofauti, either physical au sexual au emotional. Kwa hiyo hawa watoto wako kwenye hali mbaya ya kimaisha ambayo wanaweza, kwa sababu wamefungiwa ndani na wazazi ambao utakuta wazazi wenyewe wana matatizo aidha ya akili au ya pombe. Kwa hiyo wanaweza wakawa kwenye matatizo makubwa ya kuumizwa. Kundi la 4 ni watoto wenye matatizo ya akili, mental health issues. Kwa hiyo uwepo tatizo la akili, nilivyoelezea before, iwe ni tatizo la tabia, sisi tunaita behavioral challenges. Sijui kama hiyo inaeleweka kama ni shida Tanzania. Mtoto akiwa na tatizo la tabia anafundishwa tu yaishe. Lakini hiyo hapa sisi tunaelewa kwamba ni behavioral challenges au emotional dysregulation, au shida za kujifunza kama learning disability, au shida za depression, msononoko. au hofu ya ajabu, ndo kama hizo zilizoongelewa, anxiety, panic disorder na other related conditions, neurosis kama obsessional compulsive disorder, ambayo sisi hapa tunaiona sana. Hata kabla ya COVID kuna watoto wengine walikuwa wanaoga kwenye bleach. Kwa hiyo sasa hivi you can imagine wanafanya nini. Shida ya akili kama psychosis au bipolar au shida zingine mbalimbali. Wazazi na familia watapata shida kubwa zaidi ya kuwatunza watoto nyumbani, as you can imagine. Hii yaweza kuleta mafarakano makubwa baina ya wazazi nao wakaanza kukorofishana, kuleta shida zaidi. Kwa hiyo sisi hapa tunaanza kuona mabadiliko kwenye frame ya watoto tunaowaona either hospitali au kwenye simu tukiongea nao. Kwa hiyo kwa kifupi, mimi maeleo yangu au my experience kwenye hii lockdown effect hapa UK, kawaida mimi nahusika na kundi la 4 kama nilivyosema, watoto ambao wana matatizo ya akili. Mwanzoni wa lockdown kwenye wiki 4 mpaka 6 vitu vimekuwa vikiendelea vizuri tu, kimya, hamna meltdowns au crisis situations zilizotokea nyingi. Ukiwa on call mara nyingi inakuwa kimya, hata upati simu hata moja. Baada ya wiki ya 6 vitu vikaanza kwenda the opposite. Tunaanza kuona watoto wanaanza kupata shida ya kukaa nyumbani, watoto wanaanza kupata shida na wazazi, watoto wanaanza kupata shida na vitu kama inakuwa shida tu zaidi kwa wazazi na kwa watoto. Kwa hiyo unaanza kuona the mental health deterioration inazidi kutokea after the 6 weeks. So by now kwenye wiki ya 6 ya 8, on the 6th to the 8th week, after the lockdown, tunaanza kuona deterioration, mental deterioration of children in the community, ambayo tufanye sisi tunaanza kuwa na wasiwasi hapo mbele itakuwaje. As Dr. Masomi said, the future looks a bit more bleak right now with mental health care. So from there, I'd like to just talk about how to manage the situation as best we can. Kwa hiyo kuna njia tofauti, kuna mbinu tofauti ambazo tunaweza kutumia in terms of psychotherapy. So from a psychotherapy perspective, kuna mbinu ambazo tunaweza kutumia kuangalia jinsi gani ya kusaidia watoto wetu nyumbani. How to help our own children at home, how to help our own selves at home. So the moment you help your child, the moment you help yourself, everything works better that way. Kila kitu kitaenda sawa kuanzia hapo. Kwa hiyo kitu cha kwanza ni kuzungumza. Talk with your children. Talk with your husband, with your wife. Just have a conversation. Always keep up with the conversation. Watoto mara nyingi unawapata muda mzuri ni pale jioni wakati wanaenda kulala. That's the best time to get children to talk, really. In the evening when they're going to bed, wako more open kuongea, kuzungumza na kudiscuss vitu mbalimbali ambavyo vimewasumbua during the day. So they would talk a bit more about the issues that were disturbing them during the day. Cha pili ni kuendelea na mwongozo wa siku za wiki kama kawaida. Kwa hiyo kama alikuwa anaenda shule saa 2 asubuhi au saa 1 asubuhi mpaka saa 8 au 9 mchana, keep the structure going. Keep that school routine structure going. So pretend as if from morning until that time they were supposed to be at school. Pretend as if you're still going on with that kind of structure and routine. As Dr. Bora mentioned, routine and structure is very important. Kwa hiyo unajaribu kuendelea na huo mwongozo wa siku za wiki, weekday routine and structure. Cha tatu ni siku za weekend kuwe na utofauti, kuwe kidogo kuna relaxation time. Kwa hiyo the weekend usi-insist sana na kazi za shule au kazi za tofauti. Weekend kama sana kama na wewe uko nyumbani, jaribu kuwa kidogo a bit more lax, a bit more a bit more lively in the house, and things ambavyo vinaleta stress unaviweka kando. Vitu vya kushangaza sasa, kuna term inaitwa normalizing in psychotherapy, normalization. Hii ni kwamba unatumia njia ya kumwelesha mtoto kwamba ni sawa kutokujisikia sawa. It's okay to not be okay. Mtoto anakuwa na hofu kubwa, mama nimejisikia kukohoa leo, nitakuwa na COVID. Unamwambia kukohoa tu inaweza kawa ni kitu cha kawaida tu, wala usio na wasiwasi. Unajua mtoto anakuja kwako, mama I feel like I'm coughing, or I feel like I have a dry throat. Raised anxiety may start from there. So what you can do as a parent is just normalize that situation and just tell your child that, it might be just a normal cough, and it will go away in a day or two, and if it doesn't, we'll just work it out together. It doesn't matter. Kwa hiyo unajaribu kunormalize, sio kuminimize, but to normalize the situation. Minimizing ni kitu tofauti. Cha tatu ni fikra potofu ambazo hata Dr. Bore aliongelea kuwa negative thought patterns, vitu ambavyo vinaweza vikaanza kukusumbua kichwa, vinaanza kukula taratibu. Unaanza kufikiria tutakufa wote, au am I next, kama Dr. Mosomi alivyosema, hii haina mwisho, itaendelea hivi mpaka basi sitakaa nifaulu. Mtoto anaanza kufikiria mambo kama hayo. So these negative thought patterns can really grow on you and make you think that there is no end. We're all going to die. This thing will never finish. Kwa hizi ni distorted thought patterns ambazo hazina kiukweli hazina basis yoyote. Kwa hiyo ukichukua a cognitive approach of psychotherapy, ukaanza kuzianalyze, first of all ni kuzidetect. First is to detect the negative thought pattern, which can be very difficult in itself. Kwa sababu once you get into that pattern, into that wheel of a negative thought pattern, you won't easily find yourself, and you need to that's why you need to talk to someone to help you find yourself out of that. So negative thought patterns are very, very distractful in anyone's mental health.
I have a question. Sorry, Dr. I have a question. So what happens if the healthcare worker, the ones who are essential workers, they have to go to work, and the children still have to stay home, either with a family member or, like going to a daycare? What exactly should they do? Because they're being worried for themselves on their family also. So what should they do?
So in terms of these negative thought patterns that I was talking about, ambacho hata mtoto atakuwa na wasiwasi kwamba mama yangu anaenda sasa huko au baba yangu anaenda sasa huko, lazima akirudi atakuwa na, these children will also be having these thoughts about and these fears ambazo even the parent has them. So the best thing for the parent to do, I would say, is to reassure that the children are home, firstly, and tell them that, even though I'm going there, I'm trying my level best, and it will be my level best to avoid all possible infection on me. So you try and reassure your child as much as you can, even though sometimes you will feel like you're lying, but you're not, because you are doing exactly that. You are going to try your level best to avoid getting infected. And that feeling of that you're not telling the entire truth is part of the fear that you have, kwamba hautakuwa na enough PPEs, au hautakuwa kuna watu wengi wanaumwa, unajua. Kwa hiyo hizi thought patterns ambazo zinajitokeza, ni vizuri kwa mzazi pia kujielewa na kujitambua.
What about, sorry, I have another question. What about if one of the parents gets sick, the one who is essential worker, so gets sick, and then the child sees that one of their parents is sick, what can the person who is infected or family members who are affected, and then the children are there, what can they do to help those children see that situation? Because now they can see one of their loved one is sick. What exactly can they do to help that child at that moment?
Yeah, I can imagine that is a very scary situation for anyone, not just the child. Lakini ni vizuri kugundua jinsi gani watoto wapo kwenye a very different state of mind. Children are in a very different state of mind. They're easily reassured by adults they trust. They're easily comforted, and their thought patterns are easily turned into a more positive side. Kwa hiyo hata kama ni neno dogo unalompa mtoto, hata kama ni simu tu unamwandikia text message au unampigia simu mtoto, hiyo yenyewe inatosha. Mtoto akipata picha ya mama kwamba anaendelea vizuri, au message kutoka kwa muuguzi anayemwangalia mama au baba au ndugu mwingine yoyote anayeumwa, mtoto yuko easily reassured. Lakini hizo reassurances zinatakiwa zije almost at a constant rate, sio anapata mara moja kwa siku. Hapana, ni vizuri kama akipata a continuous form of reassurance to them. Na kama wako watoto wengi zaidi ya mmoja, inakuwa ni rahisi zaidi kwa sababu hao watoto watakuwa wanapeana moyo pamoja. Lakini kama yuko mtoto mmoja peke yake, ni vizuri zaidi that continuous reassurance and feeling kwamba hayupo peke yake, feeling that they're not alone, knowing that there is always someone there to tell them that it's going to be okay. That's the best statement ever. Just telling someone it's going to be okay, it's going to work out. Ni vizuri kukumbushana kwamba mimi nipo hapa, nitaendelea kukusaidia au kuongea na wewe, ukiwa na hofu yoyote niambie. Hizi stories tunazosikia za suicide imetokea hapa, suicide imetokea pale, hao watu wanao commit suicide wamepitia kwenye msafara mrefu wa mawazo mpaka hapo mwisho. At the very end we see the suicide, that's just the final thing, the final act, but they've had a long time in the past, maybe months, maybe weeks, we don't know, depending on their own mental health vulnerability, but they've had a long walk before that mpaka wakafikia hapo mwisho wakasema basi haiwezekani. Kwa hiyo you can always change the path of that person walking in that long walk, and it is always very easy to change that person's path from suicide into another direction, because that suicide point is a very narrow, very tiny little point ambayo mtu easily can go into that kama hapati that constant reassurance and constant reminder kwamba things will work out, things will be okay in the end.
And then another question, sorry. So now I'm imagining as a child, a long time ago. So I'm seeing my parents are essential worker going to work, and they're telling me not to go to play. And we know usually it depends on the age of the child. They're gonna think, okay, so if you're telling me not to go outside, not to play with my friends, not to go and hang out, and you are going to work, for them it might be a little bit hard to understand. So as a parent, what should I tell my kids? Okay, I am going to work because I have to go to work and take care of the patients, but you staying home, and you still have to stay home, you can't go to see your friends. So what are maybe a couple of things that the parents can say to these kids who are staying home?
Yeah, so this is a small age group rather than the teenagers. So this will be the age group of maybe 5 to 10 or something like that. So these children will need to be informed about the situation. They'll need to be educated. Wanahitaji kuelezewa situation ilivyo sasa hivi na jinsi gani ni muhimu kukaa nyumbani na kujitenga na wenzako, social distancing. Na jinsi gani unatafuta jinsi ya kumwelewesha mtoto wako according to their age group. So whatever information you give them about COVID should be related to the age that they are at. Na watoto wengi wanna respond very well to the superhero kind of story that you're a superhero if you social distance yourself from your friends. You'll be helping a lot of people. You'll be helping granddad, grandma. Kwa hiyo story kama hizo zinamsaidia mtoto kuelewa kwamba naweza nikatafuta njia zingine za kucheza nyumbani, naweza nikatafuta njia zingine za kucheza na mtoto wa jirani. Watu wengine hapa tunasikia other children here in England who live in semi-detached houses, wanacheza na wenzao wa kila mmoja akiwa kwenye bustani yake. So every child in their own gardens, but they can still play together because they can hear each other and they can talk with each other and they can play, they can invent different games. Children can be very inventful if given chances and opportunities. Kwa hiyo ni kuwaelewesha tu watoto waelewe jinsi gani the situation needs them to adhere to the guidelines. And as I said before, the first 4 weeks here of the lockdown, all children, even the children that we have in mental health care, have adhered very well to the lockdown, which has been quite stressful and difficult for a lot of people. But they have adhered to it. So it's just a matter of educating them and explaining to them what the situation is about, and explaining that parents, because they are healthcare workers, they still need to go to work because they are the ones who are helping these people who are sick. And most of these children will know anyway from a very young age. I mean, I have a 3-year-old and he already knows that we are healthcare workers. So inategemea na jinsi gani watoto wako wana ueleo wa kuendelea na vitu kama hivi.
Okay, thank you very much, Dr. I know we have some few more minutes for you to answer some questions, but I just want to include the audience for a second. I'm going to put the gallery picture just to take a little 30-second break. So if you can put your picture there, so we want to see everybody who is here, and I said thank you very much. We've been learning quite a bit from Dr. Sambore, Dr. Maria Mosomi, and Dr. Ali Montesel. Wait, am I pronouncing?
Yeah. Dr. Gaboni, I was going to say that Zainab was able to join us.
Okay.
So welcome, Zainab.
Okay, so just everybody saying hi, and we're just taking the gallery picture for everybody who is here. So we just thank you for your time and be able to learn with us. Hi, Manali. Hey, Miss Kisa.
Hi.
Yeah, so we just give 2 more seconds for our panelists to continue answering your questions. And please, if you have, I know Irene said there's more questions on the chat, so we're gonna start answering all those questions, and then just raise your hand or send a question in the chat room, so they're gonna start reading them where we are getting a little 2-second stretch and go back to the questions. I see some of the people still have the video.
Oh, and we also have Ms. Kisa Mwakalinga with us as well.
Hello, everybody.
He's one of the board members. Okay, so I'm gonna, so to connect that, Kisa, since you work with patient with COVID and you have experience having some of your co-workers either getting sick, and unfortunately we lost some of them. And then so having learned some coping skills from Dr. Sambora and some advice from Dr. Maria Musoni about just in case as a healthcare worker you're worried or anything else. Have you experienced any of the things or whatever you want to share with us for a couple of minutes? We welcome, I'm sure that our panelists wants to hear from you and everybody else wants to hear from you, and then we can continue with the questions. Ms. Kisa.
Wow, thank you. You put me on the spot. Anyway, thank you. Thank you so much. So my name is Kisa Mwakalinga. I'm in New York, and then I work in the ICU. So the road of COVID-19, as anybody know, that it really hit hard in New York. It was really very hard. We have a couple of co-workers who were in ventilators. So if one day you work with somebody and they understand what Dr. Musomi say. So one day you work with somebody, the next day you take care of that patient, very, very sick. You get scared. I was so much scared because you don't know who's gonna be next. And apart from that, a lot of co-workers getting sick somebody died, and we really never have a time to cry. We never really have a time to mourn. So everyone who was asking, what do you really want to do after this? Everything's over. I really want to just cry. I just want to cry because these are the people who work with them more than 10, 15 years. And they're gone, and you never see the casket. We never were able to attend the casket, the funeral. So it was hard. So you have always have anxiety. First of all, I know everybody knows that we don't have enough PPE. So just went to work, you don't have enough PPE, was scary. So the time I was really crying. I didn't want to go to work. And I reached out. And the person who I reached out was who? Was Miss Dr. Gabore. I said, I'm dying. There's no way I'm going to leave tomorrow. She really helped me to calm me down because I was scared. I was hopeless. I was just done. And she helped me to send some PPE, which I share with other people. Thank you for that. I think I need to mention that because that's the time where I really needed you. I needed everybody. And I appreciate for that. And coming home was also scary because, you know, I was so overexposed. And then I'm coming home. I have my kids, I have my husband, and I don't want to come home, bring that COVID-19 in my house. So preparation, I decided to take a shower and change my clothes. But then I isolated myself. So I'm sleeping in the basement. I don't see them. I don't hug them. So it was hard. I think yes, postpartum what did I have to say? I think anxiety and depression is going to affect so many healthcare workers, but I think reaching out for professionals. So what my job did, we get support now. That time we didn't have support, but now we're getting support. If anybody wants support, we do. But I see a lot of my coworkers, the behavior really changed. People who were very good nurses, and you see now they're fighting. You tell them A, they answer A, B, C, D. So it's something is going to be there. But I'm just encouraging everybody who is a healthcare professional just to get help when you need it. Don't delay, and you are not alone. I was there. I'm still there. I'm trying to figure out how I'm going to get to my normality. But I think I'm going to get with the support from other colleagues. And then again, I am a supervisor. So what I did, I reached out for everyone who was sick in my unit. Anybody who under me, I would used to call them. And they really appreciate that. So I think we can, a phone call make a difference. Even the text message make a difference. Because I know it did for me. So I know it's gonna do for someone. Don't, you know, that this time is hard. So, you know, try all your best to be there for them. My coworkers who were very, very sick, they get better. They, you know, 2 of them went home. So we thankful for that. And maybe we're gonna make an arrangement for the service, maybe for the people who died. We lost a lot of people. New York really was rough, but I appreciate anyone who is here, or maybe somebody, you know, somebody who came to New York. We lost a lot of people, and it really helps it to make it different. And I just want to say thank you so much. And thank you for Dr. Musomi and Dr. Bori and Dr. Mtalemi. This really helps me today, and then I think I'll share with others. Thank you.
Thank you very much.
He said thank you very much too. That was very moving, and I just wanted to say on behalf of all the participants that we send you a great big hug as well, even though it's over Zoom. But
yes,
we're here with you.
I need that. Thank you. Thank you.
Yes, virtual hugs. Yes.
Thank you.
Yeah, thank you for sharing. That's the goal of the meeting, was just to make sure we try to explain or add support, even if it's virtual support, at least for people who have been through all the healthcare workers. It does not matter what you do, but as essential healthcare workers, we salute and we appreciate all your support. So I will just ask Dr. Before I ask Dr. Stambore to add something to Kisa, I have raised hand from Catherine Dudek. Are you still there, Catherine?
I am still here.
Yes. Okay, go ahead.
My question is there a way that we can debunk the fear of providing healthcare following the pandemic? I feel our next generation will be hesitant to join the field due to COVID-19, and I'm wondering how we can inspire them to join us in this crazy profession.
It's a beautiful, crazy profession, yes. Thank you.
Yeah.
So, I'm gonna let Dr. Stambore and Dr. Maria Musomi, and if Dr. Ari can add a couple of things, hopefully, to help our upcoming workforce, healthcare workers, yeah. Dr. Stambore. Dr. Maria Musomi, if you're there.
Before I answer your question, I just want to say, Ms. Keisha, thank you so much for the service that you are providing, you and your colleagues and many nurses around the world that are providing. And we're praying for you. And thank you so much for being vulnerable to share your story and your experience. One thing that I want to let all the nurses know and doctors out there is that, you know, we are here for each other. You know, we are here for each other. We may not be in your country or your state, but I'm pretty sure most and many mental health providers are waiting and wanting to be there to support you guys and to support each other through this pandemic. So I really appreciate you sharing and being vulnerable to share. Now, Ms. Catherine, your question. Doctors or nurses are very special people. They are truly superheroes because the majority of nurses and doctors that I've spoken to who are working in this pandemic, it's like, even though there's fear there is that fire, like, you know, I have to help my colleagues and I have to help people. And it's not only a job, but it's a calling. To help nurses and doctors in the future, I can understand the fear for most young people going into the field, but I believe that the majority of providers that go to this field is really for service. And this pandemic and this situation that we have experienced, though it may be traumatic and hard, but it has brought so much positivity in how much healthcare providers put in helping people. And just speaking as a nurse, there's something special about nurses and doctors. There's just, like Dr. Harriet said, there's that fire in us about serving and helping people. And so I think we just need to encourage future providers to really search in their heart and see what they want to do, because this career really takes a lot of heart, and it takes a lot of selflessness, and it takes a lot of, you know, caring for other people. But in the midst of that, you have to take care of yourself too.
Thank you, Dr. Musomi.
I'm back if you still need me right now.
Yes, please.
Okay.
I'm sure they want to hear your contribution.
Yeah, I'm sorry about that. I was muted. Let me also say that I really appreciate Kisa.
Kisa, yes.
Kisa, who shared what they've done in New York, and that goes to all the health workers around the world. Yes. It's a place that I mentioned earlier that you are heroes and heroines that we look forward to really getting a chance to say thank you, maybe in a personal way, but nonetheless, you know, receive our very thoughtful appreciation to come your way. Let me just add a few things as we go through those challenging times. I wanted to introduce something to all of us that we use in the mental health field, and Dr. Ali, I think, is very familiar, as well as Dr. Musomi. Being mindful, and being mindful, it brings us to the point where I want to ask that we practice self-compassion and be kind to ourselves, even during this time of the pandemic. It's very important that we practice what we call non-judgmental view or perspective on ourselves. Sometimes we become so hard on ourselves, and that takes a toll from within before even that is experienced outside. For example, we mentioned about suicide a little bit through the presentation, and most suicide, or all of them, are actually a cry of emotional pain that needs to be addressed. That when people are seeking out suicide, it's not that they seek to die, they seek to escape from the emotional pain that they're experiencing. Number two, and to the health workers that were here, and I like to piggyback on what Dr. Musomi said, let's stay away from perfectionistic tendencies. Perfectionistic tendencies, wanting to be perfect by all means. And let me quote one of the good writers that I've always cherished, that said, we are first of all human beings, and only secondly, and less importantly, anything else. So even the health workers, before you become health workers, before you even become female or male, you're first of all human beings. So when that humanity is called upon, we can allow ourselves to be vulnerable and cry if we need to, and reach out if we must. And finally, we have to be in the present moment. When our minds are lingering on the future and the fear of the future, anxiety abounds. But when we're able to stay in the here and the now and ask the question, what is it that I can do now, and stay in the present moment, we are much able to actually survive the challenges. And to Catherine, who asked a question about the future generation, and this can be as well used for right now as we are here. I would wish that we are able to focus on a few things. Number one, it's important that we turn purpose into meaning, so that we actually are able to see the meaning of the whole essence of what we are doing now as health workers, and those who will join. Somebody said before, I think that was Nietzsche, who said that he who has the why can endure any how. We can endure even the how of having the PPEs and being on masks the all day, because behind that lies the meaning of what we are doing. So for the younger generation that is coming in, history has taught us that from challenges and tragedies, we are in most cases catapulted into higher meanings. And I'm hoping this can do the same for the coming generation, to find more meaning in serving humanity and appreciating and embracing humanity more than that. And finally, for the health workers, please, it's important that as much as we can begin to maintain a spirit of patience, tolerance, resilience, and hope. And sometimes those run low in such times as this. And that is the essence of reaching out, and maybe have support groups, big time support groups. In our church, we did start Zoom support groups, and they are open. We have one on Sunday for men. Those men who want to just join and talk about the challenges they've gone through, it's an open forum. On Tuesday, we have for the health workers. They come in and download on what they're going through. Have some for families. Have some for any groups that you can join and identify with. In such times as this, from a group therapist, group gives us meaning. When we find out that we share the same challenges, we can also share the same hope. Thank you.
Thank you very much, Dr. Sambore. Dr. Ari, are you still here? From the perspective of the children and the families of the healthcare worker, to answer, to add it to what Ms. Kisa was talking about.
Yeah,
Oh,
thank you. Can you hear me?
Yes.
Yes. First of all, thank you very much, Ms. Kisa, for talking. Even though you were put on the spot, I think what you shared with us was really, really insightful, and it was brave of you to share. Even if you know, it was very much put on the spot. It was very raw and was very heartfelt. Thank you very much for that. From child and adolescent perspective, you can hear how Kisa was talking about, living in the basement and not being able to see her children or touch her children or her husband or the rest of the family. That is the reality of the situation right now in most families of healthcare workers. And it is quite moving for the healthcare worker themselves more than the family, but of course everybody's affected. But how you can help is just even a text message, even a phone call, even if your phone call is missed and not accepted, someone didn't pick up the phone, the fact that you try to reach out, sometimes just that is enough. Honestly, being human is the biggest thing that we have in our strengths right now, just like how Dr. Bore was talking about, being mindful and being kind to one another is really what is showing out into the world, how healthcare workers are brave in their kindness and their humanity approach. And that's what will make people want to come into this field, as Dr. Catherine's question was leading to that. So it matters how we address the situation, and that's how people will see that this is something that we need to go into. And when we are going into it, it's about service and not about anything else. It's about humanity and service. And yeah.
No, thank you very much, Dr. Hari, for adding that part. Okay, Miss Irene, I know there's few questions there added to the chat. So if you can read and then direct to one of the panelists to answer that question, please.
Yeah, there was a question from Viola, and she asked, in cultural practices where emotion sharing is thought to be a sign of weakness, what are some ways indigents of these practices can shift to communicate these emotions?
Okay, so either Dr. Sambore or Dr. Maria Musomi, you guys can jump on it.
Well, I'll go first. That is I'm glad you actually bring up the cultural piece to this situation. And from the look of things, the number of people I've seen here, I think we mainly come from an African background, or immigrants, or those who are in Tanzania for now. Let's go back and qualify the point that we are products of culture and time. And being products of that culture and time has given us the way we do things. And perhaps on the side, define culture as the totality of life for a given people and a given place, and includes how we do our emotions. This is a challenge, especially for our men, because culturally they've not been given, or they've been socialized and conditioned to not express emotions. While we would want them to be able to express emotions, for now, because it's a crisis situation, we want to understand how they typically express their emotions or their different tendencies. But above all, we want to encourage them to be good listeners, first of all, those who are within that group. That way we can understand what they're saying. So this is a question of going to say words don't mean. The speakers use words to mean. And therefore, I want to go down and see what is it that they're trying to express, even if they don't have the language to language what's going on. I think it was Dr. Ali or Dr. Musomi that talked about nonverbal communication. This is huge in our cultures. Even when we don't say things, we have communicated. So I think there's a lot of intuitiveness that we need to pay attention to going forward in terms of what is the silence about? Can we prop that or approach that more to get what is underlying that? We have people who cannot change overnight and become emotional beings and express what they're going through because they are not used to that. But perhaps going forward in the family, we can encourage each other and model the openness that we're looking forward to see, and others can join in. But then it's a challenge, but we have to pay attention to the cultural piece of that.
Thank you, Dr. Bore. Dr. Musome?
Dr. Bore has answered that question very well. What,
Okay.
what I was going to tag on to is that for us ladies, we can often second guess our feelings and thoughts because we're always told we're too emotional. You're too scared. You know, why are you so scared? Or, you know, so a lot of times we second guess. We don't want to, by the time we're expressing our emotions, it's over and beyond. And also as mothers, you know, we tend to want to be the shock absorber on and on and on. And so like Dr. Boris say, paying attention to those nonverbal cues are very important, especially with children and also in relationships. You may have those people who like to talk a lot, and you may have those people who don't say nothing at all. And sometimes their way of communicating that something is not right is doing the opposite. You know, so you may have someone all of a sudden, you know, they're constantly making jokes, you know, and these jokes are just about corona. Well, we're just going to die. Everybody's going to die anyways, you know. A cough is coming. They're trying to minimize what is happening because they're trying to cope from that situation. So paying attention to behaviors, paying attention to nonverbal cues, and even with our coworkers, I know Kisa had mentioned that some of the nurses who were really, really nice, all of a sudden, you know, they're fighting, or you ask them one question and they're just ready to, you know, tell you A to Z, you know. All those things can be a cry for help, or a cry in needing for someone to just kind of stop and say, hey, you know, I noticed that you're not yourself, or I noticed that, you know, you're a little bit upset today. What's going on? So with this pandemic slowing us down, it also gives us an opportunity to really stop and to really listen to each other when we are communicating. It's not the usual, hey, how are you doing? I'm doing fine. No, what would you say when somebody tells you, no, I'm not doing well? You know, and taking that time to really listen to them and looking at those nonverbal cues as well.
Thank you very much, Dr. Musome.
I'm
going to add.
I'm sorry, Dr. Gavoni.
All right.
If you're going to continue on with the subject, then that's fine, because I wanted to add something. I think Dr. Bore kind of stole my thunder from me, because I was not going to speak from an academic or professional perspective, but more from a cultural perspective. And so my takeaways from the panelists today, someone did mention equilibrium. So I was thinking about the issue of vulnerability, and then also the issue of strength. And then when we talk about men and our emotions or inability to reveal them, or how we function and stuff like that, I think the important thing is the equilibrium between the vulnerability and the strength. And then the wisdom, or the intellectual part, is sometimes we're pondering when to show strength and when to show vulnerability, because remember, we think differently. So when you may think it's okay to be vulnerable, a man may not think that it's appropriate at that time. So, but it doesn't mean that we don't think that it is. We just may reveal it or use it in different ways. And then in these times, it also creates conflict or confrontation. But it's also it's how you deal with that conflict and confrontation, and it's about de-escalating and then getting to the subsurface. So that's from, I guess, to say in the scholarly terms, that's anecdotal.
Thank you, Mr. Frank. I was going to add to Dr. Arlene. Is she still here?
Hi, can you hear me?
Yes. So I was going to ask you the same cultural perspective. So we know that the parents, to our kids, we always want to look strong, be positive, and don't show signs of vulnerability. Or if usually the kids should see their parents as heroes. So now this is the same parents who has essential worker comes home sick or frustrated or scared to go to work. Now from the standpoint of the kids, how are we gonna help them to encourage them to be, to communicate or share their feeling while I'm scared to tell them that I'm scared to go to work? Because if you tell the kid like that, then they don't go to work. And so how do we present that to our kids? And of course, thinking of our cultural background, because you're not supposed to show that you are sad or scared because you are the big person in the house, so you should show strength. And usually that's why the kids don't want to see the parents get sick, because they think the parents never get sick. So now the parents is scared to tell them that I'm scared to go to work. So how are we going to frame that so the child will understand? And of course, I think Dr. Samber has said, being foreigner or culturally different from the original places. So how are we expressing? Our kids are growing up wants to know how mom is feeling, how dad is feeling, and then we are there, I don't want to tell you that mom is sad today or mom is scared today. So how do we frame that to our kids during this pandemic and every day in our life?
Yeah, emotional intelligence is quite complex, and it is complex in all ages. So it doesn't matter if you're a 2-year-old or 70, 80. Emotional intelligence can range. It does appear to be a cultural aspect to it, but it's a form of protection from yourself, because I can relate to that, because a few years ago, my mother passed away, but when I returned to work, I pretended to be very strong, very brave, and I went on as usual. And even before she passed away, when she was really unwell, I was still doing my exam and trying to continue as usual when I'm at the workplace. And I placed those two things completely separate. And I ignored all my emotions when I was at work. So it is a form of protective measure, and it does work to some extent. It does have its limitations, and it's you yourself to understand your own vulnerability. And as someone mentioned, vulnerability and equilibrium, to understand where your lines are, where your limits are, and when to ask for help. In terms of children and how to address that with them, I think normalization is really useful with children at this point. If there is a time that your child sees you sad or sees you crying or sees you in a different mood, it is best to normalize that and to just continue with a reassurance kind of narration. Emotions are continuous. We have them all the time. They never end. They never stop. It's part of being human. So that needs to be explained to children. Emotions can go up. Emotions do go down. But you can never, and sometimes we experience 2 or 3 emotions all at once. And these emotions usually come from your thoughts. And usually I go through this with children about the worry cycle and how it all begins. And it usually always begins with your thoughts. And it is those thoughts that you really have to keep a cap on. And when you get into the emotion, learn and practice how to name the emotion when you feel it. Name it, describe it, understand it. And that way you can manage your behavior after that. So it's this kind of emotional intelligence that we need to address ourselves and teach our children, and kind of normalize the situation, and reassurance, reassurance, reassurance always.
Thank you very much, Dr. Ali. Ms. Irene, do you have more questions from the chat?
Yeah, I have a question from
Harriet, do you mind if I piggyback on what Dr. Ali has said real quick?
Sure. Mm-hmm.
Let me speak from the, I like what she said. I just want to throw in what I've used. Sometimes I do some play therapy, and those are younger kids between 6 and 9, and come from the same background of CBT as the Dr. Ali's, I think, comes from the same as well. But when our kids are younger, their developmental stage is more on the concrete side. So they want to see things that are concrete more than abstract. And so when I've seen those kids during this time, I've wanted to find things that are concrete. Even when they see their parents who are health workers going to work, but they are dressed up with all these PPEs, they are reassured because that's concrete for the kid, beyond the assurance of I'm okay. And when they see you go through the routine of coming home and disinfecting, the reassurance in a concrete way is actually communicated to the kid. But when I remember one kid I worked with, and I was trying to help them with the cognitions and the thoughts and the feelings and the connection therein. And I said, our minds are like the TV stations. What do you do when you don't like one TV station? Well, and he said, well, I change the channel. And I said, when you change the channel, what happens? He said, when I change the channel, I watch a different show. I watch a different presenter, and I watch the one I like. And so we went through all this rigorous and all this routine of saying, oh, let's practice changing channels in our minds. So we changed channels to different thoughts, and we said, the question was, what are you watching now? Oh, I like this one. I'm actually watching a different channel. I'm feeling different, and I'm acting different. But you want to make sure that as a parent, you go back and find what can they identify with in a concrete way, because that's their developmental stage. Thank you.
Yeah, that was very true. I do teach the pediatric in our nursing student, and I'm glad you mentioned that, because that's going to be part of my question for next test. So hopefully they paid attention. Thank you very much. Ms. Aini, can you give me a few more last questions so we can wrap up?
Yeah, there's a question from Ayu. They are saying, how can we cope with coronavirus in places where healthcare facilities are not well equipped?
I would like one of the panelists to answer that question, but it is obvious, yeah. Going there knowing that you're not going to be fully protected, how can you prepare that mentally before getting there? Or once you are there, how can you do it? And I think part of it was answered in the beginning, but I would like the panelists at least to add to it and then help clarify for the person who asked the question, yes. Dr. Sambo,
yeah,
or Dr. Musomi?
I can go, no worries.
Okay.
I think at the beginning we did mention that there are things that we cannot, we want to ask the question, what are we in control of? What can I control? And this is not, as much as I like the serenity prayer, perhaps it's not the time to say accepting the things I cannot change, because those are the things that could actually take you down. So I think there is a need to say, to what extent am I safe, or can I be safe? So even if the health facilities are down, and I'm imagining in Africa, for example, and maybe other parts as well, then it's a time to be creative, to say, how do we minimize that? And how do I keep the distance? How do I keep the, how do I wash my hands more? What can we improvise? If the governments, and I don't want to be political here, but I'm aware of some governments that perhaps have not taken it seriously. And if the governments fail to take responsibility, this is a saying I like to always throw out there. I want to say, if I have to be safe, it begins with me. Mm-hmm. And so what is it that I can do when it begins with me? Can I make sure I have gloves, however rudimentary they might be? Can I make sure I have a mask? Right now, we are making home masks, and we can put 3 layers of cloth to help us the more. So the point is, the knowledge that we have, can we do something? And then perhaps on that as well, consult, seek mentorship. If you are stuck in your coming up with an idea or being creative, can you reach out just for consultation, and what do you think I can do to someone else out there would be proper?
Thank you. Dr. Ali, you raise your hand.
Oh, sorry, I raised my hand earlier on, but okay. Yeah, I can answer to this as well. Well, just try to answer. It's a very huge question, but I think Dr. Bore has answered very, very well, and he's completed the answer for that. All I can say is this is part of the point when you leave home and you tell your children, I'm going to try my level best to protect myself. And in the back of your mind, you're thinking this is a little bit of a lie, because I know there isn't enough protection at work. It is, we're not helpless human beings. There are ways that you can protect yourself. And as Dr. Bora explained, you will find a way if you have a will. You just have to look for it. You just have to look for a way out, look for a way to protect yourself. Nobody's going to tell you that go in there bravely and just face the patients without PPE because you're, I don't know, being political again, because your government is not giving you protection. So go in as you can, treat as many as you can, because we know that's not the way forward. You're just going to be spreading it around. So yes, just try your level best, as you said you would. Try your level best to find whatever you can to protect yourself. That's all.
No, thank you very much. Irene, another question?
Yeah, there is a question from Manali. He's asking.
I'm sorry, Irene. Dr. Mla, were you raising your hand?
Oh.
I think he needs to be unmuted.
Yes.
Sorry, I just want to add from what my colleagues have just said in terms of protecting yourself when there's no PPEs. I don't believe in any healthcare setting, maybe at least for back home it's difficult, but one of the solutions whereby as a part of a team, within the team, you're working with a team. What we've been doing in London is to initially to make sure that we try and whatever PPEs we've got to try and use it more effectively and economically. So I'll give you an example of saying that if you get you go in the ward and there's a bay, one bay has got 5 or 6 patients. So one clinician will go in and they review the patients. So one clinician will use one PPE to go in the bay and see all the 6 patients. In that way, you don't expose other patients. So in my setting, and in most of UK hospitals, all senior clinicians were brought to the front line. So the decision is made by senior clinicians, and that's what we've been doing initially to make sure that you try and use the PPE economically, but you help to not expose other healthcare workers to those patients with suspected COVID or COVID positives.
Okay, thank you very much for sharing that. But yes, I mean, as I said, the COVID being here has taught us, or is still teaching us, how to be creative and taking care of ourselves, protecting ourselves and our colleagues, because it has to be a teamwork. You can't come one healthcare person with all full PPE while the others don't have it, because you can protect yourself for 2 seconds, but then if the others are exposed, as soon as you take that PPE off, they're exposing you. So we have to work as a team. So, and I appreciate that, Dr. Mlawa, for adding that, and make sure people remember when we're going to work, we can work as a team and make sure we protect each other and help each other. Irene, another question?
Yeah, Manali was asking, is there a way we can establish mental health support in-house for healthcare workers?
Dr. Musomi?
In-house in like hospital setting or?
That's what I thought it meant.
Yeah, like in-house with the hospital. Like maybe like, you know, do an evaluation and then based off of that, you know, the hospital checks up on that worker, you know, like because every day and every week is different, you know, because I'm a nursing student and every clinical that I went to, not every day was the same. Some days I had days where I was really sad, or some days I had really good, happy days. So based off of that.
So just before Dr. Musomi answer that question, sorry. Many hospitals have what they call EPA, that's for the employees. So if you work in the one of the institutions, they have those measures that if you feel like you cannot perform your work, or somebody noticed that another co-worker is not performing, or they're sad, or something else is going on, they usually encourage you to go and report. And that's an anonymous. The management does not need to know that. The number is posted to everybody. You can access and then go with that part. I'm not sure with Corona now what the changes are, but I'm sure probably they need to see people more than that. But I'll let Dr. Somi just give us an update for what they do currently right now in the area that she works at.
Each hospital is uniquely different, but right now, I'm sure all the hospitals, they have layers of helping everyone with mental health, whether it be anxiety or just being able to just go and de-stress and to talk about your experience and how you felt that day. The other thing that is happening right now is a lot of mental health providers are using telehealth or telemedicine in order to, or telepsychology in order to communicate and offer services remotely from their home and from your home, so that you don't have to go to a facility or go to a clinic in order to talk to someone or get an evaluation or your regular follow-up, or even to just do the counseling and therapy. So there are a lot of resources out there in terms of televisits that can be done for therapy, counseling, medication management, or just getting just an evaluation. And the different insurances are still providing those services, and most providers are also doing, you know, like where you can do self-pay and stuff like that. So I would encourage with our clinicians overseas in Tanzania, Kenya, and other countries, that they can utilize those forums to be able to reach more people, because we do know that there is a mental health provider shortage. So being able to do televisits and teletherapy, you can be able to reach people even in remote places or remote clinics and be able to give them services.
Thank you very much. I'm just going to respond. One person sent me the question on the email, which they're saying if they want to be involved with the organization, be able to contribute some of the topic and be active to be a member. So if I don't mention now, I'm going to forget. So if you're interested in joining the QHSC, become a member and be active participant, like getting involved with the organization, you can go and visit to Dr. Gabone QHSC at, sorry, Dr. Gabone QHSC. You can send an email, drgaboneqhsc@gmail.com, or you can visit the website, drgabonehsc.org/, and then you can join under member, and then so you'll be active participant. Thank you for the reminder. Irene, so we can finish up. Any other questions we have in there? Or if somebody has raised their hand, that we can finish up, we're almost done.
There's a question that was asking, what are the future measures need to be in place to help not only professionals, but also their families post the pandemic?
Oh, that's the best person to answer. That's Dr. Musomi. And Dr. Borel can answer that, yes.
So what are the best measure to, repeat that last part?
What are the future measures need to be in place to help not only professionals, but also like their families post the pandemic?
Post-pandemic. So on a healthcare perspective, future measure is really, so I'm looking at it in a couple places. So healthcare systems, when it comes to mental health, sometimes we don't get a lot of funding and we don't get a lot of resources, and we have fewer providers. But measures that we can put in place is providing some of the remote ways of communicating with patients. Nowadays, most healthcare providers are doing screenings with patients. So if you go to your primary care provider or your pediatrician, they can give you a screening for depression or anxiety. I think that as we move forward post COVID-19 pandemic, that we would really need more providers in other specialties to also do provide screenings for patients to be able to make sure that they get the care that they need. Because you may not see a psychiatrist or a psychologist right now, but if you go to your pediatrician and you have a child that has been acting out, or you yourself have been feeling anxious or nervous, then they can provide you a screening, and then from there they can refer you or out to a psychologist or psychiatrist for treatment. And another thing that I think would be great to have is in the hospitals, I think we lack a lot of mental health support in the hospital. I remember working in neurotelemetry on a neuro floor. Patients will come in with strokes, they'll get treated, but very rarely would they have a psychiatric consult. And we know that individuals who suffer heart attacks and strokes are prone to having depression after, you know, the episode that they have gone through. So I think our hospitals need to be more proactive in providing consultation to patients who have been diagnosed or have gone through the pandemic, just to have an extra barrier there.
Before I let Dr. Boris speak, add to it, Dr. Ali, did you raise your hand?
Yes. I just wanted to add to the earlier question about how people in healthcare can access mental health. What we have in psychiatry here is balance groups. I don't know if anyone has heard of that before. So that was pre-COVID. So we met face to face. So this can be changed very easily into a Zoom or a video kind of session. And I think this is something that any hospital can facilitate. You only need 2 facilitators in the group, and you need about 6 to 8 people in each group. And you keep the group to a minimum, and that way it allows people to easily share information a bit more. And you don't need to have a mental health issue at all. You just need to be linked to a group and to be going into that group maybe once every week or once every 2 weeks, or sometimes it's even daily. So it depends on how you can plan it yourself, but it's a very beneficial kind of session for healthcare workers to be in that environment, to be able to share their daily or weekly or monthly experiences and problems and issues with facilitators in place. So yeah, so that's just about balance groups. That's all I wanted to add to the earlier question. I don't have an answer to this question.
That's okay. Thank you, Dr. Ali. Dr. Bore, did you want to say anything?
Sure, very quickly. I'm hoping that this pandemic, that a silver lining coming out of it will be that we actually experience some paradigm shifts. Paradigm shifts beginning from our perception towards mental health. For a long time, especially the minority groups, mental health has not been perceived favorably, and we've not been known to seek mental health services. So going forward, I'm hoping that the outcome, or among other outcomes of this pandemic, would be that we've begun to realize the benefit of reaching out and speaking with someone, a trained personnel, to help us with our mental health. So this, I hope, would actually be a very good thing that will come. Going forward again, from a family perspective, I'm hoping that we will have realized the benefits of being together as families, that we can strengthen the families that we come from going forward beyond this. But back to one quick thing that I wanted to mention about the hospitals. I'm hoping that we as health workers, or most of you, can work with your supervisors, if you're still working right now, to incorporate relaxation times during the day. And those relaxation times should be brief breaks that people take. Now go relax, do something, go take the breathing techniques. You can use those to relax your muscles. Go for meditation a little bit if you like to meditate. You can do very brief ones. To pray if you want to pray. But I hope we can incorporate those relaxation times as part of our structure in the hospitals. Thank you.
Thank you very much. Ms. Irene, any final?
No, I don't have any more questions from the chat unless other people have questions that they didn't present.
Yeah, I have a couple of finishing up. Miss Pony? Pony, are you there? Zainab, are you there? Pony, you can unmute yourself.
Let me see if I can unmute her.
Can you hear me?
Yes, we can hear you. So I know you came in late from your work, but we have Dr. Sambore and was talking about the coping skills, and then Dr. Musomi was talking about strategies, things that we need to do when we go beyond. And then Dr. Ali was talking about the children and family in response to the COVID stress. So Pony's works in Ohio, but also she works in, she went and do travel nursing in New York and took care of the patients who with COVID in New York. And she saw things more than what she wanted to see. But I was going to give her at least maybe a couple of minutes to, if she has questions for our panelists, share her experience over there.
Thank you, Dr. Harriet. And I'm so sorry I'm late. I'm running late. But it was something, you know, like I never thought I would ever see, but I did. And I mean, at the end of the day, I'm grateful and I thank God I was able to go and help, because there was a lot of help that was needed. And technically I'm a labor and delivery nurse, but when we got to New York, because we got there, we were contracted by, I was one of the nurses who were contracted by FEMA. And when we got to New York, it was that they didn't want to know a nurse is a nurse, you can work anywhere. So you can imagine I was being put in places like ICU to try and help take care of those patients. And it was very scary. It was very, I don't know what I can say, but it was sad. And as much as we went in and we were not ready, we didn't know what we were expecting, but we knew we had to do what we had to do. So, and it did hit a lot of us. Like at first, you know, you're there, you're like, you don't even have time to be like, readjust. You're like, okay, I'm here. I gotta do what I gotta do. And we just did our thing, but every day I could see people in our group, like I guess we all had our breaking points. And I could see, you know, nurses and doctors and just people will just get to that point where, guys, I cannot take this more. We had quite a few quit. They're like, this is not what I signed for. I can't do this. And it was more disheartening because it's just simple things we expect as a nurse, that if I walk into a patient's room, the simple things I'm supposed to do to make this patient comfortable is that, but we could not do them. And that was like the most frustrating part of it, either because, you know, mostly was the resources. We really didn't have resources. So we were just like making up, you know, stuff to make these people more comfortable, especially like in the med side. In the ICU, once they were there, most of them were intubated. So that was, you know, wasn't so bad. Like when it comes to dealing with taking patient, you know, like talking to these people, asking them how you can make them comfortable. So something as simple as just Tylenol, like would take 3-4 hours for a patient to get it. But I mean, I don't blame the nurses, or the doctors, but if we were more prepared, I think we need to have a system done. And I'm hoping they're working on that now, because just in case we have a rebound to where we were before, then we'll have a better system in place.
Yeah, so I appreciate you sharing, and I will share also with you and everybody else the recording, because there's a lot of things that Dr. Sambore and Dr. Maria Musomi and Dr. Ali Montilena have shared for nurses to prepare, or healthcare to prepare to go to work. Yes, resources is another thing. We're talking about self preparation. So things that they've mentioned that will help in those situations, at least to have that mental wellness, to be able to address those challenges and be able to be well enough to take care of yourself and the patients over there. So I thank you. I know you came in and you were coming from somewhere else, but I appreciate you sharing that experience, and then so we can learn. And that was the reason, the main reason for this conference, is to get our three colleagues here to come and help us see through, learn, and hopefully share this information. And I would ask you all the attendees, once we finish the recording, and I'm going to share with everybody who registered, that we get this recording and share with as many people as you can to make sure we help each other as healthcare workers. And we all know that healthcare workers, we all are very good in taking care of everybody else except ourselves. So all these skills we're given today, or all the strategies we're given today, we can use this part to try and help ourselves. So if we are well enough, we should be able to take care of others. And the profession, of course, is our downfall also, because it teaches us to care for everybody else. And we are good at it. And that's why sometimes we don't know the balance. We pass through it and keep pushing ourselves as long as we can to try and help somebody in need. So that is our role, and we will do it no matter what. But if we are more equipped with all these clinical skills, and I appreciate for all the panelists and all the people who ask the questions, I appreciate those questions, because the more questions we have, the more learning we get, and we can remember from beyond this conference. So to finish all this part, I was going to ask, invite everybody else so we can wave and saying thank you to all the people. I'm going to put them.
And let's not forget Zainab. She endured for I don't know how long just trying to get into the meeting.
Oh, there she is. I'm sorry, I called A and I didn't hear you. I'm sorry. Yes, Zainab, you can say hi.
I'm sorry, because you called my name and then I was listening.
Sorry.
I just want to say we are human beings, and for those new nurses, the young ones, doing wrong is not the issue, but doing again is the issue. So if it's happened, you feel bad, talk to the nurses who are very experienced. Just remember that when you're working, if the patient look at you and talk something like, okay, you don't feel, you feel like, okay, now I'm being abused, or not now I feel like I can't, this is a challenge for me, then just excuse yourself and go and talk with the experienced nurses. Because I remember the young one who asked about psychological problem, where you can have a help or something like that. In the hospitals, we do have the groups, and we do have other nurses, staff nurses are there for everybody. And we usually very careful with the new ones. So we are there, just ask for the help. And for us, the nurses who are mothers at home, sometimes it's very difficult when you come from the hospital, when that day has been very busy and you have to put the smile at home. Just sometimes it's okay to say to your children, my day today has not been very well, because sometimes you can have that the support you need from your children. That was it. Thank you.
Thank you very much for sharing. And now I'm going to invite back everybody on the screen and just say thank you for your time, and thank you very much for asking those questions. Thank you for our panelists, and I appreciate that. We may call you back, or maybe not, we will call you back to come and add more your experiences so we can learn from you, and I appreciate that. Thank you, and until we meet again, thank you.
Thank you.
High five. High five.
Bye.
Thank you, everyone.
Thank you, everyone. So the board members and active members, if you can stay for a few more minutes,
and students.
Yeah, they're in there.
Students of Dr. Gaboni.
Yes, thank you. There will be a quiz for that, but that's okay. Everyone for coming from UK, Tanzania, US, Norway, everybody. Thank you very much. Thank you. Thanks, Johan. You didn't get to say anything today. I was hoping you raise your hand.
Thank you, Harriet. It was a nice one.
Oh, thank you, Dr. Mkoni. Oh, in South Africa. I forgot to say from South Africa.
I don't expect to say anything.